Honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it. This Honourable Chamber will revert Standing and Finance Committee.
This honorable house is in stand. Good morning, everyone. This honorable house is in standing finance committee. Just let me remind you quickly. The honorable minister has 5 minutes to answer any questions posed to him. Members of his team, you have 3 minutes to respond to any question directed to you through the minister. Honorable members of the House, you have 3 minutes. Your questions to the minister should not exceed 3 minutes. And then you're entitled to 3 supplementary questions before you yield to, after which, as a matter of fact, you have to yield to another member. Honorable Minister, I want to start the ball rolling this morning and pick up from where we were when this honorable house was suspended with respect to lots and those lots which are overgrown in a number of communities across Barbados. Particularly, I want to address those that matter because it is a deep and growing concern for constituents in my constituency in various areas. From time to time, you have situations where neighbors, as recently as yesterday, when I visited a particular community, where neighbors complained about the overgrown lot or lots in those areas and how there are times that there have been several times when, for their own safety, so to speak, they have to clean up the lots next door, which produce, sometimes there's vermin coming out of these lots. There's what you call wood ants, which would get in the houses and such like. And therefore, they have to spend upwards, in some instances, of $2,500 to get these lots clean, and they have to do it repeatedly while the owners of the lots are either overseas and do not look to deal with these lots, or they're just here, perhaps living in another parish. Sometimes they're in the very parish of St. Lucie and do not look to deal with these lots. And hence, the neighbors have to take on this responsibility for their own good and well-being. I want to know, Honorable Minister, what is in place with respect to these overgrown lots being left, and how much teeth does the ministry have in relation to dealing with these lots so that people understand that it is their responsibility to keep their lots clean and not just not bother about it. I want to know what within your ministry there is and what can be done to ensure that this prevailing problem, repeated problem, is dealt with firmly.
Good morning, and thank you, Mr. Chairman. The matter you raise is a very vexing and troublesome problem for the Ministry of Health, in particular the Environmental Health Unit. I'm going to speak briefly, and then I'm going to hand over to Minister Ishmael and also Mr. Ronald Chapman, because the Minister is dealing directly with the environmental health of the environment on a number of issues. The problem of overgrowing lots. It's been a bothersome one for decades, I can be honest with you. There is, under the health services regulations, there is provision for prosecution, for warnings, for giving people time to clear these areas, and for possible prosecution. This has not worked as effectively over the years as it could have. You also hear, we have been speaking, government, about tightening the regulations. And we have enforced some of these, we've charged some people, but I'm going to allow Minister Ishmael to speak, and then Ronald Chapman, and I will come back if there's anything that I... Thank you.
Thank you, Senior Minister, and good morning, Chairman and colleagues. As Senior Minister would have said in his introduction, this issue of overgrown lots has been a vexing one for many, many constituents of mine, even as you would have mentioned those in St. Lucie. We have overgrown lots all across the island. Of course, we know that we are in a season of climatic change, where we're having heavier downpours of rain, and of course, this then leads to the overgrowth of grass on properties. With that comes, unfortunately, a situation where vectors are able to proliferate and to expand and produce and reproduce. We have, just in the last couple of months, coming on to the last part of 2023 into the beginning of this year, members of the public would be aware that we would have had what you would call a spike in the outbreak of dengue. And of course, in addition to dengue, you have, with overgrown lots, you have rodents infestation and multiplication as well. So this issue is a public health one, and it is one that the ministry takes very seriously. As Senior Minister would have said, there is legislation currently that allows for the prosecution of persons after a series of warnings and consultations and efforts to get them to address and redress the situation. There is legislation that allows for prosecution of persons who persist in allowing their lots to be overgrown, because we understand that this can cause public health issues, and it can cause it can cause problems relative to the wellness of our people. So we are at this point in time utilizing the current legislation to proceed with prosecutions where necessary to address this particular issue. And at the same time, while we're doing that, we are looking at expanding and enhancing those regulations and legislation to allow us to be able to have even more, as you rightly said, Chairman, teeth relative to being able to really bring this matter under control. The Environmental Health Department, as I would have mentioned and alluded to, has several different areas under its remit relative to vector control, animal control, and a whole host of other things, port health, food health, safety, etc. And in particular, the vector control is one of those areas that we've been paying very close attention to. So I'm going to allow Mr. Chapman to come in at this time to speak not only to the efforts being made under the current legislation to be able to address the current condition of our environments in terms of overgrown lots, but I'll ask him as well to expand on the two projects that we would have kicked off just earlier this year relative to vector control on dengue reduction and, of course, rodent reduction in the city and the south coast of our island. Mr. Chapman.
Good morning, Mr. Chairman. Ronald Chapman, Deputy Chief Environmental Health Officer. So, yes, we acknowledge that there's a significant issue where overgrown lots are concerned. We've had a number of complaints where this is concerned. Now, let me just explain the process quickly before I get into what we are presently doing. Normally, persons would call the environmental health officer, or the environmental health officer goes out into the district, and we see the problem with the overgrown vegetation. We identify the owner, occupier of the lot. That person is then served an abatement notice, given a specific amount of time with which to respond to to bring a resolution to the issue. If that is not done at that point in time, then that person is recommended for prosecution by the environmental health officers. We have been taking this extremely seriously. Over the last 3 months, the minister also mentioned the rodent and mosquito project that we are working on right now. what we have been doing is that we have been serving a number of notices on persons with overgrown lots. To that end, so far we have placed 15 persons before the law court, and we have received judgments in 5 of those cases to the satisfaction of the Ministry of Health and Wellness. The one person actually got charged $3,400 for the lot, which they had left overgrown. Now, there are a number of other cases on my desk, and which have also already been approved by the Minister for prosecution. So this process is ongoing. In terms of notices served, we have served a number of notices across the island. I can't give you exact numbers. One that for sure I can tell you, in the south, in the Randall Phillips catchment, we've served over 63 notices already for this month. Sorry, between last month and the beginning of this month. So we are proceeding apace to ensure that this problem is addressed and addressed in a very resolute way. Now, what the Ministry of Health has also done is to make recommendation for an amendment to the legislation, which would make the process a lot easier. You would appreciate that having to go to court and have adjournments and wait until it's a very time consuming process. And while that time is proceeding, the violation is existing and persons are being inconvenienced, and I dare say their health is being put at risk. So the recommendation makes it a lot easier to address these issues, and it makes it a lot easier to bring resolution and allow Barbadians to enjoy their property even more. Now, with respect to the rodent and mosquito programs, those programs, we started those programs at the beginning of this year, and these were a response to an increase in the number, one, of dengue cases that we have had, and the vexing issue of rodents, which has been we've been dealing with for a period of time. No, those programs continue apace. We have started, let me just say, we have started in the city, and we started from the areas for the rodent, because they're separate programs, although they're being run jointly. We are working from the Oysters Bay Garden, right down the urban corridor, right down to the Brighton's Beach. This is where the rodents are concerned, and where mosquitoes are concerned, this is island-wide. I'm sure that my time is very short, so I can't to go into all the details, but to say over the last month or so, we've seen a fall in the dengue cases. This can be partly due, I would say, to the work that is being done, and I will admit to the lack of rainfall as well. But the fact of the matter is we've been seeing fall in the cases, and this program also is going to work in tandem with Cricket World Cup to ensure that by the time Cricket World Cup starts, we have a city that is relatively free of rodents and mosquitoes. Thank you.
Mr. Chairman, with your permission, I just want to ask the CMO to speak on this matter as it relates to dengue fever.
Certainly.
So, as you are aware, we announced a dengue fever outbreak in October of last year, and we have been managing the situation to the best of our ability. The levels and numbers have come down slowly. It's not a precipitous return to normal, but we are still in outbreak mode. But we are in a much better place than when we started. We have had 2 deaths associated with the dengue fever outbreak, and hospitalizations with serious outcomes for dengue, like shock and hemorrhagic fever, have been fairly well controlled. So we are certainly in a better place with respect to where we are with dengue. And let me just take this opportunity to report that COVID numbers remain low in Barbados. And the spike we had in respiratory illness about 2 or 3 months ago, those have also trended downwards. I don't know if Dr. Rollock, she has much more technical information on the dengue fever, and she can probably be allowed to speak if so desired. Thank you.
Just say your name again, I didn't. Say your name again, I didn't hear you. Okay.
Were you able to hear me? I'm sorry. Should I start over? I'm so sorry. Okay. So the advice to householders and from the Environmental Health Department to get rid of the larval forms will help to bring down the number of cases that occur, but to actually stop the outbreak, we need to kill off the adult mosquitoes that contain the virus. And for that, we need space spraying, usually with what we use is malathion. From the peak in January up to 500 cases, just over 500 cases, we've recorded, I'm sorry.
Officer, I hate to interrupt you, but we certainly cannot be selfish. I was hearing you at the outset, but because of the system we have, so you'll have to start at the top and go so that because it wouldn't have been recorded and for Hansard. So you have
3 minutes again.
additional time to be able to get the record. So you were fortunate this morning to get your message across.
Thank you so much, Chair. The name, Leslie Rolla, Senior Medical Officer in the Ministry of Health and Wellness. As I will start again. Dengue is an endemic illness, which means all through the year, we will have cases. From time to time, according to the conditions that occur, the number of cases will go over a threshold and we will say that we have an outbreak. This breach of threshold after 2 years of no recorded cases occurred in October 2023. And from persons that were tested at the laboratory, we realized that 2 types of dengue viruses were circulating, subtypes 2 and 3. When there are multiple subtypes, there is more likely to be severe disease. So we advised practitioners and offered online training through PAHO to recognize the warning signs of severe dengue. So even though October, November, December, so far cases have peaked in January 2024 with over 500 cases, we've had more hospitalizations as expected because persons are recognizing warning signs and bringing persons to hospital, but we've had very few deaths. And the deaths have occurred in persons that have other comorbidities, other illnesses that make them more likely not to survive the severe stage of dengue infection. Since that peak in January, in February, we've gone down to just under 350 cases. I don't want to call the wrong number, it's about 342 in February, and we're hoping that that will continue in March. To actually stop the outbreak, we need to kill off the adult mosquitoes that contain the virus, CIS, and to do that, we need to fog. But to prevent new mosquitoes getting infected, we need householders, and we've asked them, as well as the Environmental Health Department, to look for the larvae in cases where they might be breeding and destroy them. So we've recognized that there's been an outbreak, we've been speaking to the public and encouraging the catchments with the staff that they have to actually go and do the inspections, look for the larvae, throw them away, scrub the containers, and for the fogging to occur in the areas where we will always have mosquitoes, but where there seems to be a press of Aedes aegypti mosquitoes. When the rain falls and mosquitoes breed, we will have Culex mosquitoes as well, but fortunately they do not carry dengue. So even though they're a nuisance, they will not contribute to the problem. Thank you.
Thank you. Minister, I just want to, I know that you cannot legislate culture and how people operate, but I just wanted, this just came to my mind in relation to the lots, the overgrown lots. People use overgrown lots to do a lot of things that are not correct. For instance, we talk about the bush, there are persons, and we've had situations where persons drive from wherever they live and they dump the carcasses of dead animals in bush and such, like, which then becomes an inconvenience to residents in the area. Would the legislation that you're looking at cover this if these persons are caught as well?
It is about legislation, if I remember correctly, under to deal with people who are caught dumping illegally. And I think this comes under the Ministry of the Environment primarily, which is different legislation from the one. We're expanding the health regulations to, rather than charging, to see if we can deduct the cost of clearing the lot from your land tax. As it relates to dumping illegally, that comes under different legislation on the environment. And there are penalties for that. I think you can even be jailed for it, if I'm not mistaken. But that is different, separate from us.
Yeah, yes, I understand. But I'm referring to the carcasses of animals, which then becomes a health threat to persons in the vicinity of where this is dumped. But I know it's a thin line between your ministry and the Ministry of the Environment. So I just want a little, clarity.
Yeah, there's clarity. For the most part, certainly on the part of the Ministry of Health and Wellness, the environmental officers would normally deal with it and not harden for us, but to give the information to sanitation and within the EPD department. But for the most part, there is that collaboration. Perhaps Mr. Chapman might want to add a sentence or two in that regard.
Yes, Mr. Chairman. So yes, there is legislation there to deal with some of these issues, and the legislation is shared between the Ministry of Health and the Ministry of the Environment. What we will be proposing a little later on this year is some additional amendments to the legislation, which will not only deal with littering, but deal with some of those issues that you have mentioned. Now, there is legislation there for illegal dumping. The challenge, a lot of the times, the challenge is trying to hold someone accountable for it, because a lot of it, you would appreciate, a lot of this stuff is done at night, and it's done in very clandestine areas. And unfortunately, persons tend to think that where there's a hole, they need to fill it with refuge. And where there is overgrown vegetation, they need to put refrigerators and other bits of foolishness, I call it, in the dead animals and so on. So when we do catch people, I think there is history where we've shown that where we have caught persons, and we did take them to court, and there were others that were caught, and they were required there and then to clean the areas. So we found persons who've been dumping in the past, and they not only cleaned the area that the amount that they dumped, but because the area was an area that was prone to regular dumping, they cleaned what other people dumped, because at that point in time we can tell we can put a name on the garbage, so they cleaned the whole thing. So, but the issue is trying to find or to catch them in the process, and I believe that the recommendation for this new legislation will help us significantly in addressing this problem.
Thank you, Minister. I certainly want to congratulate you and your ministry for what you're doing with respect to these issues raised, and I look forward to that legislation being passed, coming to Parliament to be discussed and to be passed, so that persons understand that it is not just a situation where you can get away with the things that they have been accustomed getting away with, but that we truly operate as responsible citizens. And I am certainly appreciative of the work that you are doing within the Ministry of Health and Wellness, you and your fellow minister.
Thank you, Mr. Chair.
Honourable Member for St. Philip North.
Thank you, Mr. Chair. First of all, I want to say good morning to the ministers. It's on. To the ministers and the entire members here entering the well of the Ministry of Health / Queen Elizabeth Hospital. I want to say publicly that it was indeed a pleasure working with you. Every single day of the 2 years I was there was a learning experience. You taught me a lot. We got some stuff done, and I enjoyed it. And let me say here again, by no means possible were you the reason for my resignation from the ministry. I want to start a little easy here to discuss taxes. We are all aware of the NCD fight that we as a country are facing. We are aware that the public is contributing very nicely to the fight as well. We would like more of it, but it's there. We contribute with respect to the health levy. We contribute with respect to the sugar sweetened beverage tax, which was added because of it, and we as a government increased it. I would like to hear a little bit about the outcome of the sugar sweetened beverage tax, if we know any figures that are available, and if any thought has gone into applying that particular tax towards helping with the actual NCD fight.
Thank you, Honourable Member. You've raised a very interesting area, and as it relates to these taxes, I'm going to ask Dr. Arthur Phillips to speak about it, but before he does that, I know that there has been a review of the sugar Swedish sugar sweetened beverage tax. And there's a proposal, perhaps he will mention it, I'm not going to be bold enough to mention that proposal, but you are correct, we've had, and the discussion came up to some extent, yes, on Wednesday evening, the whole matter of financing healthcare. In that project, I think you're aware, one of the recommendations is that some of these taxes, be it tobacco, alcohol, sugar, sweetened beverage, should be be allocated to financing, having to finance healthcare. But it's an interesting discussion, but in terms of the results, and I know some work was done by the University of Western East, and I hand over to Dr. Phillips, sorry.
Good morning. Arthur Phillips, Deputy CMO and NCD Focal Point. The issue of taxes and NCDs is an interesting one. Certainly taxes have the potential in very broad terms to influence behavior both on the consumer and the manufacturer/distributor side, as well as to generate revenues, all or some of which could potentially be allocated to social care, including health. More specifically on the issue of the sugar-sweetened beverage experience in Barbados and our taxation of the sugar-sweetened beverages, we have had an interesting experience, starting as we did as one of the relatively early countries, starting as one of the early countries in introducing a sugar-sweetened beverage tax at country level. There certainly was literature as well as theory that indicated that SSB taxes could have a beneficial effect on harmful or excessive consumption. So with the 10% tax, Ministry of Health would have led on the standing up of a sugar-sweetened beverage evaluation committee, the membership of which would have included civil society, academia, both on the health and the economic side, as well as colleagues in the Ministry of Finance. And that initial evaluation resulted in findings inclusive of academic publications, and in short, it indicated that the 10% tax resulted in several things. One, a partial passing on of the increase, or partial absorption, I should say, of the increase. An increased price, yes, and there was some decreased consumption. And more specifically, over the period evaluated, there was a 4.3% decrease in weekly SSB sales compared to what would have been predicted for that period. There was a decrease within that of carbonated SSB sales, 3.6%. There was an increase in non-SSB sales by 5.2%, and there was an increase in sales of bottled water by just over 7%, 7.5%. There were some issues that were noted. Clearly, some consumers switched from higher cost SSBs to lower cost SSBs. And in the initial rollout, there were some SSBs that were untaxed, drink mixes, et cetera, flavored crystals. We are operating in the context of additional guidance, not only from our local experience and our publications, but WHO has issued recommendations on sugar-sweetened beverage taxes, and there is a literature that speaks to health taxes and how they may be best applied. We are fortunate in that there is a level of policy coherence between ourselves and Ministry of Finance on the idea that taxes can reduce consumption and generate revenue. And the evaluation of the 20% tax is ongoing, and the areas that we are particularly looking at understanding and advising on relate to a tiering of the tax, or the tax increasing with increasing levels of sugar content, as well as the issue of allocating at least some of the revenue to social programming for two reasons. One, in terms of just additional revenue being available, and two, also being able to help the public understand the reason for the tax and demonstrating to the public the tax being used for this purpose. I'll pause here. Thank you.
Is there any idea of the revenue thus far?
I don't have those. I don't have those figures to hand. Sorry, I can look for them.
Thank you.
Unfortunately, we don't have it here.
Okay. My next question, I listened to the chairman of the Queen Elizabeth Hospital board when you first started, and it was interesting to hear you speak about, through this chair, of course, speak about how the CEO was chosen. I just had a couple questions on that. We all know that the QEH, let me begin by saying, if we want to admit it, that the QEH has a culture of its own, so to speak. I find it, I was fascinated by how you revealed that a survey was put to the staff to decide what type of CEO to be chosen. I thought that was interesting, but the question I have that I want to ask, and I know the answer, is why the directors of the hospital who have had myriad experience in the function at the executive level of the hospital. I'm not too familiar with the board. I was never involved with the process of choosing board members, so I do not know how many of them had experience working in an executive level at the hospital directorship level. I'm curious to know why the directors were not included in the choosing of the CEO for the hospital, considering that they more know probably what they want in a CEO. Some of them have actually acted in that position before, and I found it interesting that they were not included. Any answers?
Thank you, Honourable Member. I will ask the chairman of the board to respond to you.
Nigel Whitehall, Acting Chairman, Queen Elizabeth Hospital Board. Honorable Member, I use the generic term management. The management was surveyed. Management included the executive directors.
I know about the survey. If I were hired because of a survey, I'd consider myself lucky. But I'm wondering why they were not on the panel, for instance, for interviewing or for choosing, going through the applications for choosing the ones that they saw fit. A survey is one thing. I know why I want in a CEO if you surveyed me, for instance. But I'm interested to know why they were not included.
I think from a management perspective and from this perspective, the junior ought not to be engaged in the selection of the boss, of the person who will manage you. That is a management principle, a basic management principle. The juniors are not ever engaged in the selection of the manager. That is done in the reporting structure. That is done according to a reporting structure, the management reporting structure, which we would probably call the organogram. So a management specialist might say that that is inconsistent with the behavior, with the proper management behavior, and does not lend to proper accountability within the organization. So in those circumstances, I think the board pursued an option, pursued the course which is consistent with proper management techniques, proper management principles, and not allowing the junior members to be involved in the selection of the CEO. That's my view.
I'm going to let the PS speak to that too, as he was part of the committee.
Good morning. Wayne Marshall, Permanent Secretary, Ministry of Health and Wellness. In answer to your question, Honourable Member, it is not a best practice in terms of selection, as the chairman mentioned, to allow persons who are supposed to be basically under the charge of someone else to be in the actual selection panel. Now, what happened is that in the process of selection, these persons were included in terms of determining what specific attributes and character the CEO would have. But in terms now of allowing somebody to select somebody that's supposed to be their supervisor, that's not the best practice in terms of human resource management, and certainly not the policy of the government of Barbados.
Okay, I won't delabor that. I think it opened the eyes of some of the directors that sit in the room, because oftentimes I was asked the question. So I'm sure they're happy now to hear some semblance of an answer. My last intervention is with respect to the geriatric hospital, the new geriatric hospital that is now being constructed. I remember as a secondary school, maybe primary school student in the geography class, we often spoke about the water tables and the risk of pollution of the water tables and the reasons for not building in certain areas or doing certain storage in certain areas, for instance. We were familiar with the zones, and for which I understand are changed now to instead of 1, 2, 3, ABC now. But I've been asked, and I was scampering for an answer as to the choice of the location of the geriatric hospital, when I am aware from several years ago that that was considered. I know the zone 1s and 2s. I can't speak about the A's, B's, and C's, but I know as a student that that was considered to be a zone area where building was not supposed to happen. I have been asked by constituents far away, not only in St. Philip North, on the rationale. I've been asked by members of certain ministries, and I have asked them too, and nobody can give me a half-decent answer. I'm not only speaking of sewage seeping into the water table, I'm speaking of paint, for instance, leaching in, hydrocarbons leaching in. If you're gonna do a car part, the products used there, the oils and so on, leaching into the water table, the aquifer that we have there. And I find it very confusing. The area is near the highway, so there are pollutants with respect to the air quality of the the new geriatric hospital. And I am also aware that there had been a previous, at least I heard, so I could be wrong, correct me if I'm wrong, there have been a previous site, maybe not in this administration, but another, for which would have been safer to place the new geriatric hospital under. I mean, there are other issues, but we'll deal with that part first. The other question I have is the funding. Who's providing the funding for the building of the geriatric hospital? I need to be clear. Yes, we need to look after our old people. All of us will get old once we want to live. And I want to see them and the surrounding districts in the healthiest possible position for them and the surrounding districts in terms of water quality, air quality, and everything else that goes along with it. So if I could get some comment or answers, I'd be grateful.
Thank you, Honourable Member, and certainly I will try to answer you as best I can. As it relates to the zoning, I'm not clear. I know part of the bell is Zone 1 and parts are 2. I'm not certain. I'm being told it's called Zone C now. So I'm under the impression that it was in Zone 2. Originally in the original numbered zones. But in any case, the point you've made in terms of contamination and seepage, that has been taken into account from what I've seen as it relates to the design. It's supposed to have its treatment plant and it's supposed to have its sewage treatment plant. And there's obviously water we use to do the gardens and the lawns, etc. From what I recall, as it relates to designs they've made, they're mindful of all the things that you mentioned in terms of seepage of hydrocarbons from vehicles being parked. And I know I remember reading of some design in the car park area that would allow for the collection of any visas, etc. As it relates to ventilation, I know that there's, because elderly people don't like air conditioning, it's being constructed in such a way that you'll have a lot of natural ventilation. The issue you raised about proximity to the highway, that has been considered, and I know they plan to use burns and trees to dampen the noise, and obviously to kind of provide a blockage for whatever particles there might be. As it to the other area. Now, before the funding, there was something else that you asked. Had to do, I guess it was the proximity to the thing. And you said that there was alternative sites. I'm not certain. That would have been before my time. But the funding, as far as I know, is coming from central government, as far as I know. And the estimated cost for phase one, it's being constructed in 2 phases. The estimated cost of phase one is about 110 million, I believe. And when that is finished, that will come 300 beds. And phase two then is to accommodate another 108 beds to be able total occupancy of 408. And of course, it will have daycare facilities. It's expected to have paths for old people to walk and to exercise. It is supposed to be much more than just a hospital as it is now. It's supposed to allow them to live with dignity and to have active aging and indeed healthier aging. So that is as much I can tell you. Thank you.
Overhearing the crosstalk from the other member that sits in front of me, I remember, just clarify, was it a zone 1 before and now a zone C?
Was it zone 2? Because I live in the area too, and my area is zone 2. And under the new classification, it is a zone C, sorry. But in zone C, they have to have provisions as it relates to oils and stuff like that and disposal of those things.
All right,
so they had to do a special.
All right, I don't want to belabor it, but I want to be clear in my head. It might not be slower, it might be slower than a few. So zone 2 was what? An area you don't build on?
I live on zone 2, so traditionally, zone 2, they allowed, it was agriculture by and large, largely agriculture, and you divided into lots, in the large acre lots, because they didn't want as much as housing. But over time, that was not adhered to, more in breach, because you had the developments around Licorice Village and all these places. And we know how close they are to and they overlap with zone 1 and zone 2. So we talked about these things, but then over time we discovered that at one stage you were talking about not building, but as time went on, that was back in the 50s because of the nitrates and all of this that you were particularly concerned about. That time, no, sorry. Back then you were concerned about bacterial survival in the aquifers and in this, because it is coral limestone, it's like a sponge, so you get diffusion of water at different rates. And you were concerned about the time it would take for bacteria to survive. These days, with the proliferation of using farming and animals grazing, the issue is turned towards the control of nitrates in the water. And we have, in terms of WHO, have at times even gone above the maximum level. So the focus is now more on chemical contaminants there. And it was felt that the strict zone 1, 2, 3, 4 had to do with bacterial circulation, whereas now we're looking at nitrates, particularly in a small country that needs to do agriculture. And you have cows and sheep grazing, and they add nitrates, considerable amount of nitrates to the soil. So it's become a bit more complicated and complex.
All right, your explanation.
I don't know if Mr.
Yes,
Chapman wants
like
to add something, perhaps.
Ronald Chapman, Deputy Chief Environmental Health Officer. So zone 1 was originally restriction on building. Zone 2 Pardon me?
Because? For zone one?
As the minister has said, in the earlier days, we looked at the travel of water. It was said that it would take approximately 90 days for water to travel through the zone, to travel through the aquifer to meet where the extraction well was. And the time expanded as you go further away from the well. So the zones would move from zone 1, which would be 90 days, zone 2, zone 3, zone 4, and zone 5. The zones have been reorganized. However, specifically, zone 2, originally there was not so much restriction of building. You obviously, town planning would vet the building, but there was specifically controls with reference to the disposal of waste. So you would find that in zone 2, you had to have a septic tank, and that septic tank then went into what is called a tile field, and so on, as opposed to a suck well, which is normal for zone 3 and other places in Barbados. The minister is quite correct. What we are dealing with now, not so much is, well, we are still dealing with microbes, but a lot of the times we are dealing with now a lot of nitrates and other issues. So the reclassification of the zones allows us now to use present knowledge to make those changes, as well as.
So zone 2 is equivalent to zone C or zone B?
I think the zone 2 now is a zone, has been changed to a zone C. The zone 1, what was once zone 1, has also been changed. So what I can do is I can provide you with that information, but there has been a complete change of zones, and in some cases, some zones were made smaller, so that you don't have the exact same area. So it's not like we took zone 1 and just renamed it as zone 2. The zones were completely reclassified. So you have new zones and not the same old zones you had before.
If I may, zone 1, the past zone 1 is now part in A and then part in B, and the past zone 2. So there's overlap in the new classification. Yeah.
Okay, I will do my research because I hardly come in the house without knowing the answers to the question I'm asking. I find it interesting that a zone 2 or 1 could just up and the aquifers apparently move to a different area to cause the zoning to be different, but that might be just my thinking. That's it for me, Mr.
I believe
Chair.
that you
I
have
will
it
do
in
some
reverse.
research
There's
on my own.
There's there.
Thanks.
Thank you, Honourable Member. Honourable Member for the City of Bridgetown.
Thank you very much, Chairman. And let me take this opportunity to tell you, to say a good morning to you, Senior Minister, colleagues, and officers of the Ministry of Health and Wellness. I want to start with a sincere congratulations, not self-congratulations, but sincere congratulations to this ministry for something that has daunted me for a very long time as a youth advocate till now, where I used to, in the back of my mind, refer to this ministry, not in a derogatory way, but as a ministry of sickness, as opposed to a ministry of health, because primarily you're dealing with sickness. And what I've seen over the years, even when you look into the estimates this year, you see a lot of preventative programs, you see a lot of wellness programs. So what you're trying to really do is to keep people healthy, prevent them from getting sick, as opposed to just almost exclusively dealing with sickness. And that is something that I can tip my hat to. Last year I wanted to ask a question on this because they did a specific comparative analysis between the developed world and Barbados and the Caribbean in relation to how much money they were spending per percentage on prevention. And I've seen that we've increased that over the last 3 estimates that I've been able to participate in, had the privilege to participate in. So I want to start on that note, congratulating you, Senior Minister, and your team continue to move in that direction, which I believe is the correct direction. When you look at the statistics, sometimes I've heard, I could be wrong, I could be corrected in the course of an answer, like 80% of the deaths are through lifestyle choices, NCDs, things that can be prevented. And that's a lot, and it speaks to particularly our working population and the entire population as well. But it brings me to my first question, serious question, and that is in terms of what I find happening globally, but specifically in Barbados in relation to mental health. Depression, all types of mental health. What is the ministry's plan, or what can the ministry tell us in relation to the improvement of mental health? I don't want to get too specific, but as I look into sub-program 0377, I see stability in numbers. So it tells me that we may not have major plans because we may not have major resources. My concern as the member of parliament that represents the city, on numerous occasions I have people who have mental episodes to the naked eye. You call a community health nurse who will be able to diagnose it from a professional level, and they many times have to confess, if they're honest, Corey or MP or minister, we don't have the space. Sometimes we get difficulties with the police service in terms of picking up the people, but even when that is done, 2 tools, you see the person's back out, and the cry is we don't have the space. So if we don't have the space physically, and then I don't see the space fiscally, I know that we can have a continuous problem. So I just want to put to the ministry, what is the medium to long-term plan, particularly, but what is the plan generally in relation to the serious issue of mental health that the world is going deeper and deeper into?
Thank you, Honourable Member, for your question on mental health. I'm going to ask Minister Ishmael to start, and then I will add, if there's anything to add, and then I'll go to Mr. David Leacock, the manager, to speak specifically to the projects planned for this year.
Thank you, Senior Minister, and thank you, Honourable Member from the City of Bridgetown. And I thank you for raising the question, because mental health is one of those dimensions of wellness. Mental wellness is one of those dimensions that we at the Ministry of Health and Wellness have been focusing on. As rightly said, the ministry is not a ministry that is designed to focus on sickness, but is really supposed to focus on the health and wellness of our people. And mental health is one of those very critically important components of overall health and wellness. We would have noticed post-COVID, I think, if I'm not mistaken, and Mr. Leacock can correct if I am, we've noticed a 700% increase in the numbers of persons since COVID till now who have been seeking the services at the psychiatric hospital for mental health related issues, and within the clinics as well, the polyclinic setting. And this means that and I mean, even without statistics, I think the average person in Barbados understands that COVID was a very traumatic experience for all of us as a globe, as a world, as a people. And therefore, mental health has taken on, I think, even more an increasing state of awareness across our populations. It is important for us to understand that there is still within the context of Barbados a significant amount of stigma associated with mental health and wellness. And whilst that is the case, the Ministry of Health and Wellness is purposefully and in a very dedicated and intentional way and going about and seeking to introduce an anti-stigma campaign that will help us to reduce the levels of stigma associated with this aspect of mental health and wellness. There are persons out there that are battling many different things, whether it be depression, whether it be suicidal ideation. It could even just be a bout of sadness that is going on for a little bit longer than one would like. There are many different things that are plaguing persons from a mental health perspective. And there are persons who are hesitant to reach out for help because they think that if they were to call someone or they were to ask someone about what they're feeling and what they're experiencing, that it means that they're going to have some sort of description applied to them for the rest of their lives. But what we've noticed that in spite of that, and because of COVID, and because of many persons understanding and appreciating the importance of mental health and wellness, persons are reaching out. So that's why we're getting that increase in numbers. But there's a lot that's been taking place within the ministry, and Mr. Leacock will expand on this. But right now, there's a, and Senior Minister as well, there's a review of the Mental Health Act, which is going to help us to better appreciate the realities that we're now faced with in this current world. And we're working with many of our strategic partners, PAHO and others, to help us with that review. We have also created a hotline just recently and launched that's called Lifeline Barbados. And the number for that hotline, Minister, Honourable Member for the city and for the benefit of the public, is 536-4500, 436-4500, and that's Lifeline Barbados. And once again, it is not for, only in extreme cases, but even if you just want to talk to someone, you feel that you need to have some level of support, if you just want to just talk out the situation that you're currently facing and dealing with, you can call Lifeline Barbados and you will find someone there that will be able to assist you during that traumatic experience or during that season of discomfort and disquiet. There are many other things that we're doing. There are many activities that are being done. There's a suicide prevention action plan. There's a workplace mental health and wellness action plan. There's also a psychological first aid training action plan. And there are about 6 different action plans that we have right now in train for the Ministry of Health and Wellness to, as you rightly said, to tackle this mental health situation and to bring it to a place where it is under significant control. I'll stop there at this point in time. I'll allow Senior Minister to come back in, and then we'll go from there.
Thank you, Minister. I just want to add that the ministry attaches great importance to mental health. And I believe since 2005, 2006, we had our first mental health reform plan. And we, regrettably, almost 20 years later, we are still at the concept of having a consultancy working with us through PAHO to develop and implement this plan. The minister is correct. There are a number of areas we have to look at. We have to look at the outdated legislation, which needs to be modernized, and that is being worked on. There is the matter of the facilities in which we accommodate those who have mental illnesses. And we need to look away from the custodial type facilities of 100 years ago and certainly look to modernize. This obviously can't be done all at once, but in this direction over the last financial year, there was an upgrade of the rehabilitation therapy unit and also the occupational therapy unit, and we're trying to modernize gradually and not looking at everything all at once. Also, as it relates to this, we recognize long ago that the need to move towards community mental health care. We're getting clinics involved in mental health care. I think we made some further progress this past year. We had the addition of about 4 counselors, I believe. We got additional counselors and 2 psychiatrists, I believe, to help us in this outreach into the polyclinics. And you're seeing larger numbers of persons seeking assistance at the polyclinics. Another positive move in this financial year has been for patients being able to get the medication at the polyclinics as opposed to having to go to the psychiatric hospital with all its stigma attached to it. There's always the need for human resources, and as we move in this direction, we will need to increase our number of nurses. The training of nurses in psychiatric nursing had gone into abeyance. I believe it has resumed now, and there's a new push to get persons more interested in psychiatric nursing. Always need for psychiatrists and counselors to assist in various ways, but importantly, in the areas of occupational therapy, we definitely need to recruit more persons. Going forward, as part of this modernization, we'll have to utilize information technology, and I know that the psychiatric hospital has plans to move in this direction. We'll have to look at accurate data, we have to look at research. And with all this, to bring all of this together, we have the Mental Health Commission. So it is not lost on the Ministry of Health what is required as it relates to mental health illness. And that is a real challenge, and especially after COVID, we saw the increasing numbers of cases. And I'm going to ask Mr. Leacock to speak now specifically to some of the projects which Minister Davidson mentioned earlier, which are the things we plan to implement going forward. Thank you, Mr.
Good morning. David Leacock, Hospital Director, Psychiatric Hospital. Thank you, Minister. Remember, you raised a few points, and I will speak to some, and I'm not going to speak to the others. Now, as far as what we are doing at this point in time, we recognize definitely that there is increasing demand on our services at this point in time, and some of this came up post-COVID. We will say every situation can be seen as opportunity, and COVID definitely brought to light the needs as far as persons are concerned when it came to mental health, and making it more acceptable for some persons to actually reach out and seek mental health services. So from that end, polyclinic-wise, we are seeing a definite increase there as far as our persons who are requiring services. Hospital-wise as well, we are also seeing increasing persons coming to hospital to also access services as well. From an admission standpoint, we have not seen a significant increase admissions-wise, but we have, as you said, not returned to, let's say, pre-COVID numbers for admissions. But as far as seeking services, increases are definitely there. Dr. McClellan can speak to that as we go on. As far as Minister mentioned, we are trying to increase the number of persons who can be seen at the community level. So we are, from our outpatients department standpoint, trying to increase the persons going out to our clinics and be seen there as opposed to be seen institution-based at the hospital itself. Community integration, we are, with the drug services help, having most of our patients now at the polyclinics being seen there and receiving their medications directly from the polyclinics. So that has seen a significant change as far as how we operate at the hospital, at the polyclinics as well as concerned. During the course of the last year, we would have seen about 200, 300 persons migrate from the hospital clinics to the polyclinics and be seen at the polyclinic as well. So community integration is happening at that level. So first aid, during 2022, we had 160 persons trained in this area. And this was targeted at our first responders, some of the persons in the schools, the fire service and other agencies as well were trained in psychological first aid. This is to assist persons in disasters or day-to-day operations, to see persons who are in need of immediate interventions and to know how to help them or how to direct them towards getting help. During the last year, 2023-2024, we've also had additional 160 persons trained through a consultant. We are also at present having another 160 trained through the Barbados Red Cross Society. So we are partnering with civil society towards getting more persons trained in this area. And we are also budgeting for the next financial year to also expand and have another 320 persons trained in this area as well. Mental health action plans. Minister Ishmael mentioned that we are having 6 action plans to address varying areas. These action plans require we work with Ministry of Labor, with the Ministry of Public Service, Ministry of Health General as well, and other agencies as well. We started with government first and then working our way out. So the action plans, as the workplace wellness, for example, we are working towards having everyone understand basic mental health. What is mental health? What is mental wellness? And in turn, from a workplace standpoint, how do we ensure that we make workplaces mentally safe for persons to go into and to work every day? So that is one area we're working on. Minister Ishmael also mentioned the anti-stigma campaign. If we in turn want to have persons accept persons back into society after they've been had interventions from our end, we have to change how persons see mental health and see mental illness on a whole. So from that standpoint, the anti-stigma campaign is designed, is going to have its full launch or rollout by the end of this month, going into early April. So you should see a lot more of the media as it relates to mental health coming very shortly. So we have, from a social media standpoint, started a small rollout, and we will have official launch by the end of this month into early April. MH Gap training, mental health gap. What this is a program that allows for non-psychiatric trained persons to be able to give mental health care in a more holistic manner. So during the course of the last year, some of our clinicians were trained as trainers to in turn train other practitioners at the polyclinic level how to deliver mental health services more humanely and according to what we see as best practice. So Dr. McClellan himself has been trained, and the other consultants are also from our end and QEH, we're all trained in this area. And we're hoping that within the next year to see most of the polyclinic staff be trained in this area so they can identify persons a lot earlier.
You need to wrap up your response.
So, I would say there's a lot of things that we're trying to get done, and hopefully we can, you can see from your end as well, Minister, and the city, what we try to roll out to benefit all Barbadians as we go forward.
Right, Mr. Chair, it means that a lot is going on, and that's why you will get these types of answers. So I do
Yes,
appreciate it.
indeed, a lot is going on, but we have to still be concise with our responses and questions, etc.
Correct.
So that
Time
we
is of
manage
the essence.
time, and we can get through the head. We have a lot of things to know about health. Thank you.
Correct. So I will quickly go on to my next question and start that with really advocating officially that I believe that the mental health area, through the Ministry of Finance, the Ministry of Public Service, find it to really get some resources to improve the medication, the community care, the space where necessary. If you do a survey of the homeless and the vagrants, you realize that there are lots of mental health issues there. And I will also advocate that we can use and reach out to the non-governmental organizations, the NGOs. You see a budget here of $60,000 to that. And if I know the work that NGOs could do, Red Cross, St. John, Ambulance, etc., is a paltry figure. We could put in a little bit more and get a lot more out. My second question really speaks though to one of my most testing tribulations with the Ministry of Health through the QEH, and that is the incinerator. And I asked today on a different level, I actually asking representing people today in relation to a specific question on the incinerator. Now, in recent times, we've seen great improvements where the incinerator is concerned, but from time to time, things get really bad. And the incinerator bellows out black smoke with an odor, and my phone lights up, and it can be complaints as simple as I have to rewash my laundry, but it can go as serious as I feel like this is a life and death situation where I need to seek care to be nebulized because I have serious respiratory issues or acute asthmatics. I think I know the history and the stories and stuff like that, and I could skip that, I have that, because this is not just a question that was asked already this time or asked last year. I've actually asked all three estimates of participating in. I will probably continue to do so. I probably wouldn't have to continue to do so because the issue could be started. Now, I understand that the long-term solution or the medium-term solution is really changing the incinerator. Whether we use some or getting a different type of advanced technology that is environmentally and sustainably friendly. What I want to ask today is specific, and it has to do with the short-term solution where I am made to understand that sometimes the incinerator is overloaded, and that is what causes those very dark days, figuratively and literally, for a lot of the residents of River Road, Spruce Road, Commerce Street, Vine Street, Nelson Street, and surrounding areas. So I just want to ask a simple question, Chair. What is being done and what can be done to ensure that the incinerator is not overloaded to prevent the inconvenience or the residents feeling as though they have a life and death situation on their hand due to this very dark, odorous smoke. Thank you.
Thank you, Honourable Member. I think we all share your concerns about the residents who regrettably and unfortunately reside downwind from the incinerator at the QEH. As I said on Wednesday, the incinerator is quite old, it's over 30 years, it's gone way past its life expectancy. We have been working and repairing it repeatedly over the years. You said that every day your phone lights up. For clarity, I'm just trying to be curious and find when was the last time your phone lit up because of concern about the vent.
Right. I could probably give you the date, but I will tell you a few months ago.
Okay.
Yeah.
So you admit that there is some improvement, and we are clear about that. And the QH Engineering Department has been working really assiduously with this whole matter. They're concerned. You mentioned the overloading. I think they have introduced a protocol as it relates to that. They have done work recently which in terms of changing scrubbers and stuff like that. And I know that during that time, and it was a few weeks ago too, people weren't even sure that the incinerator was lit. I'm going to ask the Director of Engineering to speak extensively on this. I think I mentioned on Wednesday our plans going forward, consultancy to look at the management of medical waste in this day and age, as opposed to in the 1970s or when it was 80s, when that incinerator was installed. This consultancy looks at how how it is managed within the hospital. It looks at the storage and transportation, etc. And then it's going to be looking at the technologies available and what is best recommended and possibly suitable to take these people out of this terrible, the misery from time to time, and get it solved once and for all. I believe it is expected that if all goes well, this would all be finished in, I believe, a year and a half, Ms. PS. But I'm going to ask the Director of Engineering to speak to this matter in detail. Thank you.
Just for Hans, say the last time the phone blew up was the 4th of December. 4th of December, yes.
Good morning, everyone. Paula Agbo, Director Engineering Services, Queen Elizabeth Hospital. Honourable Member, with respect to your specific question, I think that you would appreciate that the incinerator is quite old and is way past its end of life. And we did explain previously that we are in the process of going through the process of the change out of that particular piece of equipment. You specifically asked about the overloading of the unit and what happens, and I think that it is not quite accurate to say that it is the overloading of the unit, but what happens what happened previously, you said your phone blew up in September, is that we had a situation where the afterburners needed to be repaired. So those afterburner parts were on back order, and they took some time to get here because of the age of the unit and the accessibility of parts for the unit. There are not very many sources for those parts, but we were able to get parts to repair the afterburners, and the afterburners were repaired. Subsequent to the afterburners being repaired, we would have found that there was not that black smoke, as you mentioned, that would be emanating from the unit from time to time. However, what we have found is that because the unit is quite old, there are different issues that arise, and from time to time, the afterburners may trip, or you may have other issues with other parts or sections of the incinerator. And as a result of that, you will find that you may have that smoke arising. It is very difficult to control with a first-generation unit that is 33 odd years old. It is very difficult to control the exhaust from the unit, given that the unit did not have specific sections in it to do any cleaning of the exhaust from this first-generation unit. And so we have tried many interventions to try to alleviate the challenges for the neighboring community as well as for the persons within the close environs of the incinerator within the hospital facility itself. As Minister said, we are actively engaged in the process of examining the new unit, and that will be a green technology. And obviously then the challenges that we're currently having with the black smoke will not prevail once that has been installed. We expect that this process will be about 18 months or so, and that obviously it is not a short project because we have to go through an extensive process, and there will be construction, well, apart from sourcing and determining the equipment, there will be construction and installation and training, and then some of our protocols may change as it relates to the sorting and things like that of the waste as well as the provision for refrigerated storage and storage so that there's not this 24/7, 365 days of burning of waste. And so we are very hopeful that with these interventions and with this plan, that we will be able to alleviate this problem for the city and for the constituents of the country very, very shortly.
Thank you.
I thank you so much. Communication, tell people, is key, not just in a marriage. What I want to recommend though is that some of this information, I work with you to get some of this information and then disseminate it to the residents. I think that could help a lot, because when I do get through a call and I find out what's happening, I find that most residents, once you can explain and bring them along, the ones that have to go and get nebulized or abandon their homes or look for somebody to take them in, they don't hear well after that, but the rest you could talk to. So I feel that if we could disseminate this information, I think that would be useful. My third and final question, Mr. Chair, speaks to the way human resources. Human resources is very important for any institution, yeah? There are a number of, this is probably my number 2 problem, incinerator at 1, appointments at 2, backlogs at 3. Thank the member for St. James South for asking that. But appointments, a lot of people are asking about their appointments within the QEH. A lot of people are concerned that they are scheduled 3 weeks on, 2 months off. And the problem is, they say that the 2 months off, I can't feed my family, right? Now, my question is, does the Ministry of Health has any plans in relation to settling this HR issue? Or is this an issue that will have to be raised primarily with the Ministry of Public Service? How do I go about, as a member of parliament representing a number of people who work in the QEH, located in the QEH, speak to these many people who have this dire concern where they're only getting work on an off basis and causing tremendous suffering for them and their family as they seek to put food on the table?
Thank you, Minister. I believe you are directing this question at QEH, or you're directing at the ministry and QEH?
Mostly people work at QEH, so it would be guided by you, Senior Minister.
I don't know the people that you're speaking about, so I'm just sure. I'm going to ask the Director of Human Resources of the QEH to speak specifically to these matters. Thank you.
Good morning, Susan Reeves, Director of Human Resources, QEH. Good morning, Susan Reeves, Director of Human Resources, QEH. During the last year or so, we would have appointed a number of persons within our establishment. We would have done approximately over 106 employees who would have been appointed, and we are now looking to appoint a further 97. During that course, what would happen, those persons that would normally be engaged more frequently, you will have less work because we are governed by our emoluments, which will have a number of posts which we can only utilize. So as a result, you will find that persons who would normally have maybe 3 months or 4 months in, they are no longer getting that period, those periods, because they have a number of persons who would have put into vacant posts. So we have those persons now in vacant posts, which will be permanently appointed to those posts. That would be 106, 2023. We would have done that also in 2021. That would be 202 persons, and now we're looking at 97 persons. We have currently another 20 posts or so which we will be looking at for those persons to be appointed via satisfactory performances.
Mr. Chair, I'm very happy with the information. I pray that many of the persons who call are within that 97, there are about 6 or 7 of them that I praying in R97. So I am very, very happy with the answer there, and I think we can proceed. Thank you very much. And I want to say thank you again to the Senior Minister and his team for the information shared with not only me, but with the entire population of Barbados. Thank you.
Thank you, Honourable Member, and my advice would be to keep praying.
Thank you, Honourable Member. Honourable Member for Christchurch East.
Thank you, Mr. Chairman, for recognizing me. I don't know whether this was asked in my absence just now, but we are facing the stark reality that Barbados has an aging population. The stats show that it's of great concern, and we are increasingly being faced with persons who are suffering from either dementia or Alzheimer's or things like that. I have heard many stories of persons trying to get assistance or caretakers for their relatives who might be suffering from either dementia or Alzheimer's. And there seems to be a shortage of persons trained in dealing with people who have this particular issue. So we are in the process of constructing a new geriatric hospital. I know that there are facilities that I guess tend to address the concerns through the state. But we started a home health program, and we started other programs aimed at trying to assist persons in taking care of their elderly relatives. But I know from experience how difficult it is to find people who are competent and capable of dealing at home with persons who suffer from either dementia or Alzheimer's. So we're having the issue where in some instances it may be cheaper to try to deal with people at home rather than disrupt the person who's already bordering on some degree of confusion and trying to put them in an environment that is not familiar to them. If there was a structured way of addressing and managing those persons to give the family members a break, because these diseases are not only difficult on the actual patient or person with it, but they're devastating to households. They put the persons in the household who have to take care of the patients under serious stress, and quite frankly, it causes problems for them as well. So I'm just wondering whether there's a provision over the next year to expand the capacity to deal with persons who suffer from either Alzheimer's and dementia, and whether this also includes a program to equip people with the necessary skills to be able to take care of them in their own homes.
Thank you, Honourable Member. The matter you raise is a very difficult one indeed to deal with and to manage from the ministry's perspective. Management of persons with dementia and various stages of Alzheimer's is not an easy task. And you speak of training people to, I'll start with keeping people at home and having persons there trained. I know some persons try to deal with this matter at home, but then it becomes very difficult. And as persons with Alzheimer's deteriorate, it can become extremely difficult to manage when they become aggressive and threatening and accusatory in their beliefs. There's no immediate plan to assist people in training people at home. What I can tell you is that the ministry has entered a partnership with Chamberlain University to do 2 cohorts of 15 each, to have nurses pursue a master's degree in gerontology, to become nurse practitioners. So it's a mixed nurse practitioners slash gerontology course. And this would certainly give them the skills that would be needed to manage and to do something like this. Certainly at this stage, the ministry doesn't have the resources to do that. This is something that is going to take, I believe, at least about 2 years to get the first cohort out. But the plan is that we have signed up to have 30 senior nurses go through this process. I'm going to let the chief nursing officer speak in a bit when I'm finished. And that was a matter of dealing with persons at home and having them, nurse practitioners go to their homes and perhaps advise and the relatives how to deal with the situation. You made a point of some of these people, these relatives, needing to have some downtime and to recover. And we're looking at facilities that can, or facilities that would allow for the accommodation of some of these persons on a temporary basis. Having said that, the Alzheimer's Association has been pursuing this and having discussions. There was an agreement, not a written agreement, certainly in terms of discussions, to assist them with the facilities that could be outfitted for the needs of those persons who suffer with Alzheimer and dementia. But there's no plans to do that in this year's estimates. I believe we were looking at the Gordon Cummings Hospital in St. Thomas, which is in a terrible state, some sort of not to rebuild and to work with the Alzheimer's Association so that government undertakes to renovate it, and that they take part and we assist each other in a symbiotic process to make it available for persons who unfortunately have developed Alzheimer's. So those are some of the things we're looking at. We recognize it. At this point in time, a lot of them are also managing our facilities. I believe we've been speaking about mental health, but the largest percentage of persons in patients at the psychiatric hospital are what we classify as psychogeriatrics. And this is a wide range, which includes dementia and Alzheimer's. So as pertaining to having solutions this year, not going to happen, perhaps in next year. When I say next financially, I mean 25, 26. Thank you. The CNO to speak a bit on this too.
Good morning, Chair. Anastasia Jordan, Acting Chief Nursing Officer, Ministry of Health and Wellness. Honourable Member, as it relates to the training, in addition to the planned course for the nurse practitioner, you would be happy to know we also have a program at the BCC for nurses trained in gerontology, which has been ongoing for more than 4 years, where these nurses are specified, they're trained in specified areas relating to how we do treat to Alzheimer's, dementia, and to cater for the aging population of Barbados. In addition to that, there are many schools outside of Barbados Community College who deal with what we call auxiliary nurses, those support nurses, those caregivers mainly, to assist with the home situations to which you are speaking about. The General Nursing Council registers those caregivers so that they go through a curriculum which has been established and certified by the Nursing Council, so they have the skill sets that is necessary to be able to help those at home. So we know it is an issue. The aging population is indeed one that we are looking to address in the nursing profession, and it calls for a balance. And we are going to be looking at other ways, hopefully within the next 2 years or so, actually looking at having a gerontological program in the community to expand the services to also assist those persons at home who need that type of intensive care as it relates to nursing.
I hear you.
Thank you.
I hear you loud and clear. And in relation to the program of the auxiliary nurses, the difficulty here, I'm not trying to flog a horse. The difficulty here is that, as I understand it, to deal with people with dementia, you need people who can help to engage their minds, people who can deal with them a certain way, not just a generally trained auxiliary nurse or something. This person at a particular stage of their life with a particular disease that has to be dealt with in a certain way, you need to be able to engage them. The complaints that I keep hearing are that when you get people in, the persons don't actually know how to stimulate them, right? And we've had a number, even within our own grouping in here, the number of people with senior relatives who've expressed the frustration and the concern. This is not to point a finger at you or to suggest anything. It is simply that we have to deal with the reality of the situation we are facing. It's only going to get worse. So to me, some initiative, some encouragement, some incentive needs to be provided for this emerging and exceedingly relevant area because there are a lot of people, right? People can't get the family into the geriatric hospital or the geriatric system, right? People are trying their best to deal with people at home, and it is frustrating a lot of people. So I'm just suggesting that this may be something that needs to be considered as a priority area for development or facilitation in Barbados.
Mr. Minister, I must I spoke to this and I said that we are having nurses to specialize in gerontology. It's a gradual process. I heard you mention auxiliary nurses.
No,
That's not what I'm talking about.
The senior nursing officer is the one who had mentioned the auxiliary nurses as a way to bridge that gap. So I was actually...
I understand that you're talking specifically about Alzheimer's and those other things.
Correct.
Which need special. I don't know that the auxiliary nurses is what I was thinking about when I responded.
I'm on the same page as you, Minister.
I don't know that you are, because I don't know that we have the resources to do everything at all in the same time. Right now, as I said, some are accommodated at the psychiatric hospital, some are accommodated in the geriatric. We have the alternative care, the other program, which government funds to accommodate a number of them. So I take your point, but I wouldn't want it to go abroad that the Ministry of Health and Wellness is not really doing anything about it. I went further to say that we have had discussions regarding providing and refurbishing Gordon Commons to meet the requirements, and we're working with the Alzheimer's Association. So I wouldn't want the impression to go out there that we are just neglecting and not looking at Alzheimer's treatment. And from your tone, with respect, I get that impression.
Minister, I'm sorry that you heard it that way, and rest assured that was not my intention. I took great pains to point out that I'm not attempting to assign any blame to anyone. So just for the record, that was not the intention. I was expressing a concern that was raised and asking for clarification, which you did clarify. Thank you.
Thank you.
Second question. Let me start by saying that I want to express my gratitude to the Randall Phillips Polyclinic and those who operate within its capacity. I have found that your services and your officers have been quite responsive to numerous complaints from the catchment area. And I've become very familiar with Mr. Chapman. And I find that when we raise issues, they're dealt with very quickly. So I'm just asking here now, in relation, while we push to get the legislation done that deals with the nuisance and the regulations that deals with making property owners responsible for their properties, is there any way or any provision that we can accelerate the inspections and prosecutions until such time as that happens? Because quite frankly, when I saw the flurry of prosecutions about 2 months ago in the newspaper, right, in one, you saw people cutting and dealing with their properties. So just the fact that persons were charged in the paper, a flurry of activity started. It has died down a little bit. So I'm just wondering if there's any provision for an increased inspection and response to the issues that are being reported, especially as we are now approaching the start of the hurricane season. So the grass and the overgrowth yields its own complications in the hurricane season, not just with the mosquitoes, but also with flooding and inability to control the flow of water into the areas it's supposed to go.
Thank you, Minister. I accept your praise of the Randall Phillips, but
high praise, high praise.
High praise, but I'm going to speak before Mr. Chapman because I know that he's not attached to that catchment area. He's attached at the central ministry, and I don't know that he spoke extensively on this matter this morning. And it gave that we are already, that they've been serving notices and they have prosecuted a number of people this year. I know because they come to the minister to sign off for persons to be prosecuted. So it is something that they're already doing. And as part of the vector control program, they are doing more inspections. I know because I accused them of not doing enough before, and I've seen increasing numbers. So perhaps Mr. Chapman will want to add.
Yes, Minister. Ronald Chapman, Deputy Chief Environmental Health Officer. Minister, Honourable Minister, I understand where you're going with this, and as I mentioned earlier, it is important that we look readily at the recommended legislation, amendment to the legislation, and that those recommended amendments are designed to speedily, to really increase the speed at which we're able to deal with these issues. So I don't want to rehash myself again, but I think we need to be able to address that and address that quickly, and we'll be able to see these problems being addressed in a much quicker manner.
I close, Mr. Chair, simply by saying I appreciate the effort and the work in the Ministry of Health. There's some ministries that are easy to point fingers at because of the scope and the fact that, quite frankly, for example, the Ministry of Health, everybody at some point in time collides with the Ministry of Health. Everybody. So while people may not always collide with MTW, while people may not always collide with environment, while people may not always collide with, I don't know, home affairs, every single person in Barbados at some point in time has to experience one of the facilities or services offered by the Ministry of Health. So it is easy to point fingers, but I think people, if they're honest, can see the improvements in some respects in the healthcare in Barbados. And actually, I can personally say that I have noticed an increase in the responsiveness when I've reached out to certain departments within the ministry. And just for clarification, Minister, the reason I call Mr. Chapman is because, unfortunately, he's one of them people who, like, every ministry has them. You go to that person, and then that person either directs you to who exactly to go to, or they will make the call themselves and the things will happen. So Mr. Chapman's facility has probably been abused by many of us, right? So I know he's not attached to Randall Phillips, but I was just appreciating the work that he has done and the work that he has done in collaboration with the Randall Phillips to address the concerns in our catchment area. So having been properly and thoroughly answered with those two questions, I don't need to ask a third.
Thank you, Honourable Member.
Thank you, Honourable Leader of Government Business.
Thank you, Mr. Chairman. I beg to move that you do now report progress to His Honour the Speaker and beg leave to sit again.
The question is that I do now report progress to Her Honour the Deputy Speaker and beg for leave to sit again. All honourable members in favour, say aye. Honourable members against, say no. We think the ayes have it.
Honourable members, your chairman has reported progress and asked for leave again.
Thank you, Madam Deputy Speaker. I beg to move the suspension of the House until 12 p.m.
12. The question is that this honourable chamber be suspended and asked to sit again. Be suspended until 12 p.m. Honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it. This honourable chamber is suspended until 12 p.m. This sitting is resumed. When the suspension was taken, the House was in standing in Finance Committee, and to that we shall revert.
Honourable Member for St. Philip West.
Thank you, Mr. Chairman. Mr. Chairman, the nexus, the linkage between health and education is something that we all understand. We know that a student who is, or a learner, I should say, who is well nourished and is in good health is able to have better cognitive function. They can think better, they can process information better, they can concentrate. A hungry belly, you can't focus on a hungry belly. They recognize that they will also do academically better in school, and their attendance is significantly improved because of better health. And I want to start, Mr. Chairman, by thanking the Ministry of Health and Wellness for the support it has given us in very specific and tangible ways over the last year that has allowed us to not only as a ministry put things in place to enable learners to learn better, but has also enabled us to remove some barriers that have prevented some persons from learning. And in particular, to the minister through you, Mr. Chairman, I really want to thank the Ministry of Health and Wellness for the support through the polyclinics, the Queen Elizabeth Hospital and the polyclinics, for the help they have given us with regards to, for the first time in many, many years, the testing of students for sight. We have been doing the testing of first formers across the system for screening them for sight challenges. This started in October last year. And in a significant way, out of 2,519, we had completed, as at the beginning of this month, about 1,561 of those first formers. And that is about, and of those, that's about 62% that have been tested. And we are currently working with the ministry to find out how many of those have had to be referred, so that it's not only how many have been tested, Mr. Chairman, but how many are actually referred and getting the help that they need. So that is a very tangible way in which they have brought the testing for sight back to the school system and to improve education. In addition, there has been work that has been done with regards to hearing. There are 3 areas of diagnosis we've agreed, Mr. Chairman, with the Ministry of Health and Wellness to work on, which is sight, hearing, and speech. And very quickly, as I approach my question, sir, in the area of hearing, which we've also done with private sector companies, with the Steinbach families, private foundations, with a number of other non-governmental organizations, we are really seeing the benefit of this. As we have looked at the statistics, Mr. Chairman, we saw that in 2023, 11% of those who were actually tested had to be referred for some type of assistance. So this is not an insignificant number of persons who are being caught in the system. What I want to ask about is the last specific area, which is that of speech therapists. We know, Mr. Chairman, that there is but one speech therapist, from what my understanding, within the government system. And in terms of private persons, there are about 7, maybe, out there from what we're being told in the private sector. What this is doing, it is significant, this lack of expertise in this area is significantly impacting the Ministry of Education's ability to respond to students who need that type of screening and have that need for diagnosis and intervention. My question, sir, to the Ministry of Health and Wellness is, how is the ministry working to expand access to this type of expertise at this point in time, recognizing that on island, we do not have enough persons who are trained in that area, and that we need now to expand so that we can better serve the whole country, not only the children.
Thank you, Honourable Member. What you're saying, first of all, thank you for your praise of the ministry in regard to its work with site testing and additional work with hearing. You mentioned, well, you're absolutely correct. We have one speech therapist on staff currently in the ministry, and she covers the Bertie Graham Center, the former Truth Development Center, Albert Graham Cecil Graham Center, Development Center, and she also covers the polyclinics, and she also covers the QEH. There's a post, I believe, at the QEH which is not filled, because the difficulty has been recruiting speech therapists to work in the public sector. It has to do with the remuneration, and they do much better in the private sector. So obviously they prefer to work there, where it's much more lucrative. But we have a deficiency here. This is an area where, and I'm glad you've asked about it, because certainly we need to have people trained. I know at one stage there was some training in some aspects of it, at least at the community college, not to the full level, but to be able to assist speech therapists. So we certainly need your ministry to look at this when we go with national development scholarships, and to see who might be interested. Meanwhile, we have been working with the MPS to get at least 2 to 3 additional posts to help, because the waiting list for persons to be seen by the speech therapist currently is about 450, 460 people who are waiting just to get an assessment. And hence the caution of the Ministry of Health as it relates to this testing, that it is obviously unethical in terms of testing without having the resources, the speech therapists that you need to go out there and test people as it relates to autism stuff. Then you're creating expectations that you cannot meet. So it is an area that we are very concerned about. But we do hope that the two ministries can work together to see if we can rectify this. Even if once we get the post, I believe we can try to recruit from abroad meanwhile to get ones to do that. But it is something that we are very concerned about.
Thank you very much, Mr. Chairman. May I continue? The second question relates exactly to where you left off, where the minister left off, which is that in collaborating with our ministry, particularly as it relates to training. Now, we have had some work done with each other over the last little while that has allowed us to not only start to reconsider and revise the paramedics program, but certainly the associate degree in paramedical science will be offered for the first time at Barbados Community College here in September this year. In addition, we have been able to work with you on the community health nursing program, and as you know, just recently about 18 graduates came out of that program, 16 local and 2 who were non-nationals. You know that we continue to work with you on the emergency medical technician program training, and that the midwifery program. And we want to thank the QEH for seconding an officer to the Barbados Community College to help us to be able to pull that program together. We are planning that at the beginning of April, we will be able to launch that new program. That is the preamble to my specific question. As we continue to work with you on the many different areas where education serves the health sector, what in this year's budget what is the scope for additional resources from the Ministry of Health to support the educational side in these particular programs, including the nursing program, where we have not only expanded numbers, but we have also improved the quality of the outcomes for those students who are actually now able to pass the regional exam. We need some additional resources, not just human resources, because these are specialist areas that require specialist experts in the area to do some of the training to help us build the programs, but there are also skills labs that we would really be happy to have that support for. So the question, Mr. Chairman, is what is the scope for additional support from the ministry in this year's estimates to help facilitate us helping you?
Thank you. Of course, you know the ministry already provides a stipend for to allow your nursing students to participate. But we have been advocating, this ministry, for some substantial support for you at the BCC relating to training, certainly, especially as it relates to nursing. We have advocated in the meetings that we've had with the Ministry of Finance that there's a need at the BCC for additional tutoring and staff in various areas as we expand the training at various specialties within nursing and certainly as it relates to paramedics. We are still committed to assisting you with personnel to assist with the program. I think you know that I'm concerned that there needs to be more clinical and practical training and on-site training in the QEH because the medical and paramedical and nursing is best taught and learned at the bedside. And we are committed to that as providing persons once again to assist with clinical, with students when they come on the ward. Naturally, the senior nurses do this and is committed, providing some additional resources can be provided for them. And this has been discussed at a different level. This kids lab, this is something that I know the QH has done in the past for nursing, and I believe that they can do it again. It's space. I know that they had some of the buildings in the Enmore area at one stage that were used, and certainly a space they should be able to find some space where some of your nurses, your student nurses, can have in that kids lab develop certain things, especially at the time when we are insisting that your student nurses now needed to be able to do venipuncture and take bloods and set up IVs. I'm sure that the QH is extremely willing to assist in this regard. I know that the CEO would support this, and we've had discussions about it previously. So there's a commitment. I can't tell you in terms of a finite figure, but we will assist you in kind, and I've been advocating on your behalf that more attention needs to be paid to BCC. We need to train more nurses because there's definitely a shortage. We're looking to recruit nurses again, and we need to train more nurses. For you to allow us to train more nurses, you need additional resources. So we are working together in this regard. Thank you. I don't know if the CEO wants to add anything.
I would never resist the opportunity to talk about my personal profession of nursing. So absolutely, I am Dr. Christine Greenwich, the Chief Operations Officer. And yes, we have a very robust plan to enable our nurses to get to the level of 2024 professional practice. Whether it is broadening the skills in terms of phlebotomy skills so that they can start IV lines, those practical skills. But most importantly, in 2024 nursing education, looking at simulation, which is the skills lab. Simulation now has AI incorporated that will foster not only hands-on physical assessment, but also making those clinical decisions based on actual patient or clinical scenarios. So that, along with the traditional classroom type of didactic education in nursing, will supplement and enhance, and I think foster that independent, autonomous nursing practice.
Thank you, Mr. Chairman. Having dealt with the diagnostic testing and screening and the training, how we serve this ministry, the final question I have relates to the implementation of our National Schools Nutrition Policy. Now, if you know, we have been working together not only with this ministry, in fact, it was this ministry's initiative that led to this policy being so real, and your collaboration with the Ministry of Education is very much appreciated. We have worked also with the Heart and Stroke Foundation as well as with the Coalition for the Prevention of Obesity in Children and other non-governmental organizations that are seeking to work with us more closely. Where we have had some success is in the number of schools who are now not selling sugar drinks, even though some of them do have artificial sweeteners in them. The statistics that have been provided to me is that about 95% are not selling sugar-sweetened drinks, even though, as I said, they do have some artificial sweeteners. A number of schools have banned sugar drinks in whatever form altogether, so they only sell water on the premises. And of course, we have trained with your support all 21 of the canteen concessionaires currently with regards to the implementation of the policy. Now, this is at the secondary level. Mr. Chairman, my question relates more specifically to some of the work that we need to do at the primary level, particularly as it relates to our school meals department. Your National Nutrition Center has been unable, when we have requested, to be able to respond to the needs of our school meals department in many ways. You have been able to do many things, including help us test some of the foods to look at the content of food, but we need to be able, in very precise ways, be able to look at the nutritional value of the meals, be able to publish that and let it be reliable information, and to further provide technical assistance as we seek to revamp our recipes to make this national nutritional policy have real meaning at the very basic level. And my question to you is there scope for further resources from your nutrition center or other resources to assist our school meals department in particular with the work that we have to do to guarantee better quality meals on all the different fronts?
Thank you, Honourable Member. I'm going to ask Minister Ishmael to tackle this question, and Dr. Arthur Phillips, the Senior Medical Officer, Acting Deputy Chief Medical Officer.
Thank you, Senior Minister, and thank you, Honourable Member, for the question. You're hitting at the heart of wellness, which is core to what we're doing within the Ministry of Health and Wellness. The larger and wider component of what you're reflecting on relates to our NCD fight. And NCDs right now, as the Honourable Member from the City of Bridgeton would have mentioned, is responsible for about 8 out of 10 deaths in our country. 80% of the deaths in our country are due to non-communicable diseases. And as it was said earlier, these are largely preventable diseases. They're based on lifestyle choices, and risk factors lead to the incidences of NCDs being high. Now, one of these risk factors relates to poor nutrition. So as it relates to the school nutrition policy, that is one of the policies implemented by this government, as you already know, to aggressively address the NCD fight and to bring this number from 80% down to a more manageable and sustainable figure. The school nutrition policy is one component and one prong, but we have under development right now a national nutritional policy that is underway as well, and that is right now going through the process and the paces between the various ministries and the various stakeholder groups, and that will come to fruition after it goes through cabinet and et cetera. That will come to fruition in due course. There's a number of things that are being done. I'm going to ask Dr. Phillips to come in and to speak relative to the specific nutritional questions, but I can say on a very broad and policy level, there is quite a bit that is being done for us to be able to address the NCD plague and issue. We have a national task force on wellness that has been established. We also have an NCD commission that is in place and doing tremendous work. And there's much consultation and advocacy that's being taken place by them. And if you're, persons who are in tune with social media, you will see that there has been heightened information being shared on the various social media platforms of these two entities to help persons to regulate and to address some of those various risk factors. I mentioned nutrition being one, but of course, lack of exercise and lack of physical activity is another one of those risk factors. And of course, that leads to people being overweight and obese. And these are all things that contribute, of course, to the proliferation of NCDs amongst our population. So all of these areas and risk factors are being addressed through different mediums. And I must say that there's a heavy emphasis on good nutrition. In fact, I would say that this month is actually the month of March has actually been declared Nutrition Month. And we would have had openings service just about 2 Sundays ago, where we would have introduced that into introduced the month really into the Barbadian landscape. And I believe the theme for this month is good nutrition, a prescription for NCD prevention and control, if I'm not mistaken. So you can see right there again, to the core of your question, nutrition sitting at the center of what we need to do to address our NCD issue. So I would allow Dr. Phillips to come in at this point in time and to give some more specifics relative to the support that we can offer through our National Nutrition Center. There is quite a bit of work that's being done. As I've met with the team there, I know that there's quite a bit of technical support that has been offered to the Ministry of Education in the area of nutrition, and the School Meals Department being able to benefit from that. And we know that much more can be done. And we're hoping that during the course of this financial year, we'll be able to render a lot more assistance technically and other ways to the Ministry of Education and the School Meals Department in particular. Dr. Phillips.
Thank you, Arthur Phillips, Deputy CMO, NCD Focal Point. So just by way of context, I need to signal that certainly the National Nutrition Center is committed to continuing to assist Ministry of Education. Right now, the primary mode of that contribution is through our sitting on the implementation committee for the school nutrition policy, which looks broadly at 3 areas. One is the physical environment, which speaks to food and physical activity. The other has to do with the curriculum, and the last has to do with the wider environment, which would fall more squarely in our laps, and that would include issues such as taxes, labeling, and marketing of unhealthy foods to children. In terms of the specific ask in relation to nutritional content and caloric content guidance from the nutrition department, that can be quite an intensive undertaking. Nutrition Center is available and is willing to assist and to provide guidance. The current situation within our nutrition department does pose some constraints in terms of capacity, but we are absolutely committed to assisting and supporting. I do note that in the past, the structures around the school feeding program would have included nutrition expertise, and that may not be quite the case as it was in the past. We certainly believe that there is benefit in there being dedicated nutrition expertise available to Ministry of Education, considering the level of detail and the size of the scope of the work that is required to advance that agenda. But as I said, we're certainly dedicated to continuing to contribute, primarily through the work on the policy, but also, as we have done in the past, in reviewing menus and advising on menus and assisting in that way. But some of the elements in terms of the detailed nutritional content and caloric content may go beyond our current human resources capacity at this time. Thank you.
So thank you very much, Kenneth George. We have had a good relationship with the Ministry of Education, and it has been enhanced during the process while we did the school nutrition policy. I believe that gap you have identified could be bridged. The history of it is that the National Nutrition Center in the early days gave much more hands-on instruction with respect to the school meals programs. I think the issues of human resources will always come up, but the gaps can be bridged. Please also note that we also give some dietary direction to the prisons because that's another vulnerable population. But I think the two ministries can work with each other to ensure that the issues within the school meals program, because I understand there's tremendous wastage of foods. They try with the fruits and vegetables, but the children may not necessarily be happy with that. So we have to be innovative, and we have to understand what the children want and provide a better service.
Good morning. Good afternoon, rather. We are Marshall, Permanent Secretary. I want to speak to the issue of human resources, which was touched upon by the Honourable Member as well as the Chief Medical Officer. Now, the current resources of the Nutrition Department cannot certainly serve the large number of requests that we're receiving for assistance, and certainly cannot meet the mandate of, let's say the new mandate, which is being driven by the new things existing in government and the requests that are put on the Nutrition Center. Now, currently, in terms of technical staff, there are only about 7 persons working, and 7 persons to cover all the various areas such as the school meal service, the prison, and then working on the policies that are requested is not in any way enough. We have requested some additional staff to be provided for the Nutrition Center, and the request is currently with the Ministry of Public Service. But more than that, I think we need to look at the mandate, because certainly the mandate is outdated, and based on the changes that are happening in society and the need for more current and also adaptable nutrition policies, there's a need to restructure the Nutrition Center as well as diversify its mandate. So this is the intention of the Ministry of Health in terms of its commitment to nutrition within Barbados.
Mr. Chairman, thank you. Those are my 3 questions. I just hope through you that the minister heard the support of his team for a designated resource to our school meals department, which carries up close to 40,000 of our population. Thank you.
Thank you, Honourable Member, and be assured that we work assiduously to help you with the nutrition. As the CMO said, we used to do it previously, and we will try to assist you. Thank you.
Thank you, Honourable Member for St. Philip West. Stay in the East, Honourable Member for St. Philip South.
Thank you, Mr. Chairman. I promise you that I will be brief. I have 2 questions and, if possible, 1 follow-up. I want to first start by thanking the Ministry of Health for the work that they've done with my ministry, particularly when we were trying to get through the SPS measures legislation. And of course, during the consultation we had with the animal rights organizations in Barbados, where your CMO was very strident at that meeting and helping us to get those people to understand that, yes, we work together, but we have a culture in Barbados that we also have to respect as it relates to animals, and in this case, in particular, dogs. Recently, we've been seeing in the press a lot of complaints about people being attacked by dogs, stray dogs, and of course in Barbados now, there's a love for very large dogs. People often get the wrong impression of dogs, and the greater the size, of course, the more fear people have of dogs. And under CAP 177, which is the Licensing and Control Act, the Ministry of Health is responsible for the management and curtailing of these stray animals and those who are not properly kept. I've worked with the unit already. I've made several calls and have had good responses to my calls. But there's a misunderstanding out there that this is really the responsibility of the Ministry of Agriculture. Perhaps where I'm leaning to is for us to set the record clear in terms of what is being done to assist people who make calls, people who are having challenges, and then what is being done to help deal with this issue of stray animals, in particular very large dogs that people are complaining about in recent times.
Thank you, Honourable Member. As it is, you're correct that the Animal Control Center currently falls under the remit of the Ministry of Health and Wellness. For a second there, I thought that you were advocating that you were prepared to take over responsibility for animal control across Barbados, but apparently you changed midstream. It is certainly an area that we are concerned about. You're correct. And every time one of these serious events occurs, it raises the whole discussion again and again. And I think the ministry is taking it seriously and is looking to address to address it most stridently in the coming years. And in this regard, I'm going to ask the Chief Environmental Health Officer to speak to this matter, and then the PS to give you a little glimpse into things that we are looking at. And then I will come back, Minister. Thank you.
Good afternoon. Francina Bascom, Chief Environmental Health Officer. The Animal Control Center, yes, you do collect stray and strained dogs, because we're finding that the owners of dogs, they tend to release them at night, and they go then, that is where you would find that person's having challenges with their animals being attacked and stuff like that. So we do have that whole problem of straying dogs as well. It's not just the stray dogs. And what we have found in recent times, that persons no longer can manage their dogs and they are just letting them go. The Animal Control Center do have that program, so they do collect them, but you would understand based on our challenges, we just have 7 kennels at the Animal Control Center. And sometimes we are unable to bring dogs in because you may have, depends on, as you said, one of these big breed dogs, they are unable to mix with the other dogs. So you may have 2 or 3 kennels taken up with those dogs, or you may even have a dog with pups. So we are unable to have a number of them in, and we only have a once-a-week vet in, and basically it will be for euthanization of the dogs. And that process, we moved from 600 to last year, we had 987 dogs being euthanized. So it's showing that the unit still is collecting those dogs. Unfortunately, we are working with the animal welfare persons, and I think persons have an issue with the whole concept of euthanization. However, we have no way to keep them. Persons are giving them up who presently have them. So euthanization is the way that we have to go. We are trying to rehome, and there's a small market for that. So you would find person, we will have those person would come, identify, and they would take some of them, but it's on a small scale. Because last month, we would have had 127 in, and only about 12 of them we were able to get rehomed. So we are still collecting them. The unit at some points would ask persons who wants to surrender their dogs, if on the day that we are doing euthanization, if they can bring them in, because there's only so much space and there's only one vehicle right now that is doing collection.
Yes, following on from what the Chief Environmental Officer has indicated, I want to speak to the whole issue of animal welfare. Now, it is recognized that in Barbados there's a need to educate persons in the area of animal and health welfare. And in this regard, the ministry is embarking on a project to employ, or at least to increase the number of posts within its establishment to provide someone to provide these very skills in the ministry of itself. So this person, which will be called an animal welfare coordinator, will be responsible basically for monitoring animal welfare, for checking on any animal found with a potential for a welfare issue, and to be a liaison between the stakeholders in the private and private sector, and also responsible for providing and facilitating outreach and educational activities to the public of Barbados. So the Ministry of Health views this area one of concern, and certainly we will ensure that we address it in the near future.
Thank you, Minister. I hope that answers your concern, response to your concern. That is satisfactory.
Yes, at least I'm happy to hear what is being done to assist and for the public to know where the competent authority is as it relates to dogs. Because we've been inundated with calls at the Ministry of Agriculture. I was having this conversation with Mr. Chapman this week. And I did raise with him, and I will raise here now, Minister, what can come out of a brainstorming exercise as it relates to policy with the ownership of large dogs, pure line dogs that people love, they want to own, but invariably they're kept on a chain or rope all day long in the sun, very small kennel, there's no fencing, and these are the ones that people feel threatened by. And oftentimes, if they get loose, I receive a lot of calls in the ministry for our black belly sheep being killed here in Barbados and not in Guyana. And we have to then dispose of carcasses, and we really have a major problem with stray dogs destroying sheep, particularly. And I'd like to know if there are any future plans in working with places like Ocean Acres and those who have a keen interest in these animals, and how we can look at policy to address what is going on.
Thank you, Honourable Member. Interesting that you said that we had the brainstorming. This brainstorming occurred, I believe, about almost 20 years ago. And I'm glad that you mentioned Mr. Chapman's name, because he was very much involved. He knew about the plan for tagging of these animals, but you would license them and they would put a subcutaneous tag on them so that we always know who they belong to and who were the owners. And if they were found strained, you could deal with the owners appropriately, especially if the dogs had attacked someone. I know that we ordered thousands of tags back then. That was sometime in 2006 or 2007. We'd had discussions with Mr. Wayne Norville. We had discussions with some of the vets in the ministry, and there was this lovely plan to deal with this. Obviously, the vets were involved in terms of tagging the animals, and we thought we were well on our way. Perhaps I should ask Mr. Chapman to speak at this time.
Thank you, Minister Ronald Chapman, Deputy Chief Environmental Health Officer. And yes, myself and the Honourable Minister did have some conversation about the larger breed dogs. There may be, at some point in time, need for legislation which deals with aggressive animals. I think that's a wider conversation which would include Ministry of Agriculture, Ministry of Health, and the vets and other civil societies which are interested in animals. I would want to say, though, that we presently, our actions, where, as Ms. Bascom have said, we're not only dealing with stray dogs, but we're dealing with stray-in dogs, those which are released at night and so on to move around. So I'll just be brief. I think that we need to have more conversation, but at the present time, we are working with a number of animal rights groups, and that conversation actually started 2 years ago, because there are a number of groups in Barbados that are extremely interested in animals. One of the things that Ms. Bascom said, we have also rehomed a number of dogs to Canada. There's a program where we shipped a significant amount of dogs over there to be rehomed. So there are a number of facets to addressing this issue, but more conversation and more a wider conversation needs to be had concerning the treatment of these animals.
Thank you. I need probably to apologize to Mr. Chapman. I was putting him at a time and a place where he apparently wasn't there. My apologies. Clearly, I should have remembered that you were not as senior as you are now then.
Mr. Chairman, my final question. Thanks, Mr. Chapman, for your response. Minister, Six Rose Polyclinic is one that is really heavily used by the people of St. Philip. Many of them are from working class communities, and there used to be a dental health service at that polyclinic, which is no longer there. Is there anything you can tell the public, especially the people of St. Philip, about the dental health service at the polyclinic in terms of if it will be resumed, when it will be resumed?
Thank you, Honourable Member. And certainly, there are plans. We've had issues, as I think you're well aware, as it relates to construction and work being done at that clinic now since almost probably a year and a half, almost 2 years. And regrettably, the dental services have been curtailed there for over a year. There are plans to get them back as soon as possible. I'm going to ask the Chief Technical Officer to speak to that, because he'll be able to give you a time frame related to the construction work that has to be done. And then I'll speak again. Thank you.
Chairman, Greg Sahin, Senior Technical Officer, Ministry of Health and Wellness. Honorable Member, yes, we recognize that this particular polyclinic has many challenges, and dental, for instance, is one. Many spaces clinical spaces have been affected, and we recognize that they have been addressed due to the age of the plant have affected these spaces. The plumbing, absent guttering, construction that have been halted, and we could go on and on. Some work currently is ongoing. For instance, we finished the counselor's office only last week. We had some age piping, so we did some replumbing that we would say about 3/4 complete. The plan, because of this clinic, it is naturally ventilated as well, so the high volume of patients creates heated areas. So the plan going forward to the southern side of the clinic, we would expand the waiting area and make it more patient-friendly. But respect to dental, the tiling in dental is complete. We only have to do some remedial work. I would say 90%. We have to install the chairs along with the compressors. We are engaging the consultant with respect to this, and I would say comfortably in about 6 weeks we should have dental up and working.
Well, you just blessed my heart. So I can go back to the Republic with my head high. Mr. Chairman, I want to thank you for the opportunity. Minister, I thank you.
Thank you. Thank you.
Thank you, Honourable Member. Honourable Member for St. Michael South.
Thank you very much, Mr. Chairman, and thank you, Senior Minister and your team, for the work you would have done, obviously, in Barbados over the last few years, and for your responses to these questions and during the course of this session. I want to begin, of course, by thanking the ministry for its role, its most senior role, leading role, in dealing with the COVID pandemic. And the fact that I think Barbados will eternally owe this ministry and the former Minister of Health, the Most Honourable, permit me to say the Most Honourable Colonel Jeffrey Bostick, for his leadership in that regard. But I also feel that we now need to have another conversation, Senior Minister, in relation to the state and the possibility of future pandemics. The truth is that as we deal with climate change, as we deal with the relationship between man and animals, and now man and very wild animals, apparently, the fact that people travel every day to different parts of the world as well. I mean, there are a number of reasons I would imagine that the possibility of a future pandemic looks quite possible, and perhaps some might even say is certain. To that extent, Senior Minister, I am wondering, how are we as a nation, how is the Ministry of Health preparing for what seems to be an inevitable reality for Barbados in relation to the likelihood of a future pandemic? I mean, it may not manifest itself in the same way as COVID did, obviously, but there's a high chance that we could see a future pandemic. I also know that during the height of COVID, for example, when we rely on HIV information, for example, we were not getting that information because the ministry's focus, as it should have been, was on addressing the pandemic. And therefore, I guess you can't be in the church and the chapel at the same time. But perhaps this is also a lesson for us to be in our state of readiness so that we can be in the church and the chapel to a certain extent, so that we do not have to perhaps relinquish or direct day-to-day responsibility for other matters to the extent that we can. I mean, a pandemic is what a pandemic is. So I'm just wondering, what is our state of readiness? My other concern really about the pandemic was that it became a health issue primarily, but it has serious social consequences. We saw, and we continue to see, the mental stress of COVID that COVID has placed on Barbadians. We see it every day. We see it now with the number of evictions I believe is associated with COVID and the post-COVID trauma. And the relationship that I think should be built before the next pandemic with social ministries, with Ministry of Youth, the Ministry of Education, and so on. So I'm just wondering, what is our state of readiness and what we're doing to prepare Barbados and Barbadians for the likelihood of a future pandemic, while, of course, commending the ministry for the way it handled the last pandemic. Thank you.
Thank you, Honourable Member. You have raised a question that we are also looking at, I believe, as on the World Health Organization, PAHO, and indeed Barbados, the whole matter of pandemic preparedness. And I'm going to ask the Chief Medical Officer to speak on this initially, and then I will comment after.
Thank you so much, Kenneth George, CMO. We live in a global village, and with movement of people and diseases, there will be threats for future pandemics. It's likely to be respiratory in nature. We have done a few things to strengthen our ability to respond, particularly with respect to the capacity of the Best DeSantis Public Health Laboratory to test. They have expanded their molecular base. I don't know if this chamber knows, but we were recently certified as a recognized center for influenza within the region of the Caribbean. And that signals our ability to do much more testing with respect to new and emerging threats. We continue to work with PAHO because we need to have an alert system which gives us information quickly and before we need information for action. So we have strengthened and deepened our relationship with PAHO. We have invested in our laboratory response, and Sanji is here, and I'm sure she's going to respond. But I think what we learned from the pandemic is a couple of things. That contact tracing is probably only useful early in a pandemic. 2, the closure of borders does not work. And we also learned that we need to be able to rapidly respond to the threat at hand. So I think we are certainly more prepared at this point. Pandemics are difficult. We learn as we go, but I think based on how Barbados was able to respond, that certainly we are better prepared in terms of our laboratory, in terms of our surveillance capacity, and in terms of particularly what we did well was scale up our response with respect to our human resource capacity to respond to a threat on the ground. So I will ask Sanjay, because this is an extremely important issue, and the laboratory has invested in a lot of equipment and supplies to broaden their base with respect to their ability to test. Dr. Sanjay Beckles.
Good afternoon. Sanjay Beckles, Director of the Best. Dr. Sanjay Beckles, Director of the Best of Santos Public Health Laboratory. With respect to outbreaks, yes, those are things that continue to happen and will continue to plague us as we go on. Outbreaks are something that are inevitable. And definitely for sure in terms of movement of persons, whether it be locals going overseas or persons coming in, the potential for bringing in diseases with us as we travel exists. What we have been doing at the laboratory is working close collaborations with PAHO, and they help to guide us really in terms of what is on the horizon. So as new diseases are popping up within our region and outside of our region, and we start to see trends developing in terms of movement of these pathogens across the world, what we do is actually start to expand our capacity to do the testing. And under those circumstances, a lot of times PAHO facilitate the training of our staff and provide the startup reagents to be able to test for the new pathogens that are circulating. Once we have that testing, and based on the capacity of the lab and the equipment that we do have, we start to ensure that we implement and valid and verify the tests are actually working in country long before the pathogens reach our shores. So for example, if we look at COVID, actually we were trained in early February, and within the same week of training, actually we had our first request. And so we were prepared and had reagents on hand even before we thought it was going to be such a big outbreak. That has happened in the past, even for influenza H1N1, when we had the first outbreak of swine flu back in 2009, 2010. And even on the horizon, as we are seeing other new pathogens coming up, we already have in our arsenal reagents and supplies to be able to start to test for things such as Oropuchi virus and Mayaro virus, which we are seeing popping up in other places within Latin America. Thank you.
Thank you. I'm going to ask Dr. Corey Ford, the Director of Clinical Services at the QEH. Dr. the Most Honourable Corey Ford.
Dr. Corey Ford, Director of Clinical and Diagnostic Services at QEH. I just really like to thank the Honourable Minister for bringing this question to floor. It's something that's actually quite dear to me in terms of preparing for pandemics and deal with infectious diseases in general. My comments are going to be twofold. One, in terms of the actual staffing and preparation for pandemic. And then number two, how does QEH in itself, how are we aligning ourselves to be also part of this process? People will be ill and they will probably end up in the QEH, and we need to identify things pretty quickly. And then our cooperation, of course, our growing cooperation with Best of Santos. So in terms of staffing and training, in terms of preparing for the pandemic, I think we well know that we have a cadre of people who are on the ground who are actually prepared to stand up for a pandemic, and that becomes important. But to tell you that we've already started collaboration with the Ministry of Health and internal training within the QEH in terms of our infection prevention control network to try to expand that capacity in terms of identifying, in terms of improving surveillance, not only in QEH, but extending that sort of surveillance within the polyclinic sector, because people can walk in from anywhere, from any part of the globe. So this is a continuous process. And internally within the QEH, we're continuing to train our staff on a monthly basis in terms of dealing with infectious diseases, but we have a cadre of people that we can call to floor should we have that chance. Of course, we have the Edmore Center, which can deal with infectious diseases. Secondly, and more importantly, and one of the certainly coming out of estimates is that we at QEH are looking at really separating out microbiology and expanding that department in collaboration with the Best of Santos. And as part of that process, we're looking at trying to see how we can get some, and it's been improved in general, some equipment which allows us to cut our identification time down from 5 to 10 days to about 1 to 2 hours in some cases. This will allow us to quickly identify our organisms, including some respiratory illnesses, which allows us to perform tasks and isolate people accordingly. I would say coming out of this as well is that we are in collaboration and continuing collaboration with Best of Santos. Should we find anything, we consider them to be the national reference center for identifying elements, so we can pass it on. But to assure certainly you, Minister, and the public that certainly if we are in fray of coming up with another pathogen, that we stand ready to provide the services to protect all Barbadians as we have during the COVID pandemic. Thank you.
Thank you. Honourable Member, I also want to lead on to future pandemics, and I couldn't do that without us looking at antimicrobial resistance, and that is being predicted by some to be the next pandemic. So I would ask me, Mr. Chairman, to indulge us so that I could ask Dr. Coreyford and then Dr. Sandri Beckles to perhaps update the chamber in terms of all preparations for antimicrobial resistance, recognizing that the Prime Minister of Barbados is the chair of the Global Leaders Group on Antimicrobial Resistance. Thank you.
Chair, may because that was actually my follow-up question based on the answer. So just allow me to put the two questions together then. It was going to be the concern that I have, and you hit it on the head, Senior Minister, is in relation to the antimicrobial resistance that I suppose eventually is going to make Barbados more vulnerable. But are you not concerned too that coming out of COVID, there seems to be an unwillingness on the part of Barbadians to even want to vaccinate their children, which also exposes the vulnerability or makes the country even more vulnerable. So my follow-up question, as you answer that, is also in relation to the vaccinations and what we are doing, because this is not just talk, right? What we are doing to prepare the country for these things and to allow Barbados to be ready for what I believe is, in essence, the inevitable. So those two, the antimicrobial resistance as well as the immunization reduction.
Thank you. And I recognize you were not here, you were overseas yesterday, but we did deal with this, but certainly the fall off in normal childhood immunizations is a major concern for us. It is a concern because, as I said then, that the numbers, especially for MMR, measles, mumps, rubella, have fallen off. And currently in the world, in Europe and North America, there is an outbreak, a resurgence of measles. So it is something we have to be concerned about, bearing in mind that Cricket World Cup is coming here in a couple of months. So this is something that we're concerned about. So I can ask the Chief Nursing Officer to speak, as she so eloquently did yesterday, as it relates to the immunization and how we're planning to roll out this to counter what is happening, and then ask Drs. Beckles and Ford to speak on AMR. Thank you.
Good afternoon again. Anastasia Jordan, Chief Nursing Officer, Ministry of Health and Wellness. With regards to the vaccination and the interest being placed currently on the fact that we have vaccine hesitancy in Barbados. This is something that we have been addressing over the last couple of weeks intensely, especially coming up to World Cup. And we have put a program in place where polyclinics are now going to be open on the weekends so that we can encourage mothers with children who have been defaulters, because we recognize that we've had a long list of defaulters over the last 3 years due to the COVID and the vaccine hesitancy. So we are targeting those defaulters so that we can address that matter, especially with the MMR. We are also doing public service announcements starting on Monday to drum up awareness of the importance of vaccine use and trying to get the public to understand the importance of trusting that vaccines do save lives. So there is an ongoing campaign. We're getting ready for Vaccine Week, which is in April. Collaboration with PAHO and the public health nurses are driving this. We have the mobile clinic, which we are using to increase access to primary healthcare services. So there is an ongoing drive from the nursing perspective to address this, because it is indeed a very important aspect when it comes to healthcare.
Thank you.
With regards to, Honourable Minister, with regards to antimicrobial resistance, remember in 2015 as a country we saw first, one of the scary bugs, but carbapenem-resistant Klebsiella pneumonia, which was really caused a havoc for the hospital. Since then, in 2022 and 2023, we saw the emergence of carbapenem-resistant E. coli for the first time in Barbados, and now another interbacterial group of organisms. What does all of that mean? That means for us that we are in a bit of problems when it comes to antimicrobial resistance, but I will tell you the tide has certainly changed. Within the QEH in itself, our aim as an infection control department was to try to control the spread of antimicrobial resistance within the hospital. This has certainly changed. These bugs I just mentioned are now coming from our communities. What does that mean for us? There needs to be a really serious cooperation between what we do is in medicine, but what we do in agriculture, and the use of these antibiotics. If we're going to get past this, it will also need to be legislation which will support, or stop the illicit use. I use the word illicit use of antibiotics within our community. So now we have a community-based problem, certainly within our community. What I would say is how we're going to get past this is, one, we're going to have to really beef up our infection prevention control in terms of human resources within the hospital. And we've recognized that in having a community-based problem, that we need to partner with some of our other healthcare facilities. So we have started training in antimicrobial stewardship within our geriatric hospital. So we've taken it outside the QEH and now within the psychiatric hospital. We've started and implemented a clinic, antimicrobial stewardship pharmacist who now operates within the hospital facility. And then the structural mechanism of trying to look and see where we need to go, I spoke about before, the real beefing up of our microbiology department within the hospital. And the aim of beefing that up is allow the department to now look outside of things such as bacteria, look at viruses, look at parasitology, and work with the molecular basis at the Best Santos laboratory, and really aim to identify bugs early. If you identify bugs quickly, and the support is given financially for us to get the equipment to do that, we can move from identifying bugs between 5 to 10 days, and some we can identify now within hours and implement the correct therapy from the beginning. What that does for all of us in the room is it helps us economically, because we don't spend a lot on antibiotics, which are sometimes very expensive in some cases, and allow us to get control of infections early and impact the mortality and the morbidity that we see in patients. The acts in this particular stream today, of course, is to, like I said before, to improve the capacity of the infection prevention control department within the country. But I'm going to finish off by saying this. and this is strategically important. Barbados, in September, will lead the United Nations General Assembly in attempting to get a global consensus on this area of EMR, which will be led through our own Prime Minister. And I think this is very important, and I think the question alone speaks to understanding of the importance of this at the international level. If we do not get this situation under control by 2050, not by me, but by the same World Health Organization, this will become the most common cause of death in the global south.
With respect to diagnostics at the Bester Sanders Public Health Laboratory, what we have embarked on already is enhancing our capacity to detect and identify microorganisms a lot quicker. So along with the manual methods, which may take, as Dr. Ford indicated, several days, we've actually recently acquired 2 new pieces of equipment, the Malditoff MS Prime and a Vitec machine, which will help us to identify bugs within a few days. Once we have the organism growing on our plate, we can actually identify the bug within 60 minutes. In about an hour, we can actually identify. One of the other machines would actually be able to do the susceptibility as well, so then it tells us what is likely to be resistant to and what drugs will actually work. We've also moved another step further in that we are able to do genotyping on some genotypic tests on some of these organisms as well to identify the particular gene that is responsible for the resistance. And that would also help the clinicians in terms of guiding them towards what drugs actually they can prescribe to the person to get rid of the infection. Again, working with the QH, what we hope to do, because all of this information is good for us from the lab perspective, but how does this actually translate to action or changes, or if it actually works on the clinical side. So we have all these diagnostics, and we are working, and we're going to be going forward working with the QEH even closer, so that at the end of the day, once we identify and we can say this will not work, they can actually see how the drugs are performing in the real-life setting in vivo in patients. Additionally, what we've also been doing is that we are encouraging the other private labs in Barbados that do microbiology and may identify some resistant organisms and stop there. We have a collaboration, informal collaboration with them, where they may actually send us their organisms as well, and we are then able to do further testing and advise them accordingly. So again, this is something that is not new, but definitely the drive to actually make it better and ensure that Barbados can respond a lot better to AMR is definitely in the works. Thank you.
Thank you.
Thank you, Senior Minister. Thank you, team. I really do think that this is perhaps one of the most important conversations the country needs to have. In both of these conversations, one is primarily in the science with the antimicrobial resistance, and the other is just a social thing. Like a number of people who are fear-mongering and have the potential to reverse the progress of a country over something that we really need to fight. So I want to thank you for your response, and I also want to encourage you to keep up this fight. My second question, sir, is in relation to breastfeeding. I was going to speak about elderly, but I won't. I know we don't have a lot of time. I did visit the geriatric hospital, though, not as Minister in People Empowerment, but as an MP visiting a constituent. And I must tell you, sir, that at that time I found the geriatric hospital in Beckles Road, which is also in my constituency, to be extremely clean. The grounds were extremely well maintained. It smelled extremely fresh, and I just showed up twice now. And the patients seem happy. So to whomever is responsible for the geriatric hospital, I give you the biggest of kudos. It's very, very well maintained. But my second question, sir, is in relation to breastfeeding. Now, I had the opportunity to be named a champion about 2 or 3 years ago by the Heart and Stroke Foundation for childhood obesity prevention. And I remember one of these sessions, there were a few, but one of these sessions that I had the opportunity to attend, there was, permit me to say, sir, there was a doctor, I think Dr. Bernard was her name, from the Breastfeeding and Childhood Nutrition Foundation. And during the course of that conversation, while we were having a conversation on obesity, it then strayed in really and truly to a conversation on breastfeeding. and the potential for breastfeeding to reduce childhood obesity, but also to reduce the chances of diabetes and a number of other diseases that we battle with. Now, I'm a strong believer that prevention is better than cure. That's why I think we need to talk about antimicrobial resistance. I believe prevention is better than cure. But I also know that a number of young Barbadians are not engaging in breastfeeding their children. And I would just want to know, what can we do? I mean, perhaps to work with that foundation, perhaps to encourage Barbadians in the communities, I don't know. But what can we do to make breastfeeding more common? I'm told that breast milk changes depending on the time of the day. It gives different nutrients during the course of the day as to the nighttime. It helps children to sleep. A whole set of positives. And I was just wondering, because having had 2 young daughters, both of whom were breastfed, perhaps not long enough, I guess, when I listened to Dr. Bernard. But I do think it's important for us to breastfeed. And I just wonder what we're doing to make it happen, and what else can we do to make it work. Some mothers may obviously say that. Some women, I mean, the reality is that I guess if you are struggling yourself and perhaps you're saying you don't have the capacity to feed yourself well, but I do think maybe contained milk may be more expensive. But I think we have to look at it as a social issue, obviously, but as also from the Ministry of Health, what are we doing to encourage breastfeeding at the community level, to support breastfeeding, recognizing seriously that this is perhaps one of those things, one of those unspoken variables that determine whether or not we continue to face an NCD crisis. And so I would just like some direction on that, please. Thanks.
Thank you, Member. It is another area that the ministry is focused on. Generally, the QEH, the polyclinics, it is a general focus on that, and of course the nutrition department, the importance of breastfeeding. I'm going to ask the Chief Medical Officer to speak to this first, and then the Chief Nursing Officer, because there's quite a bit going on.
Yes, thank you, Kenneth George, CMO. The Ministry of Health policy is exclusive breastfeeding for the first 6 months of the infant's life. We have always maintained that approach. We cannot legislate a breastfeeding policy. So what it requires us to do is more moral suasion, public education, and engagement. The other issue, along with breastfeeding, we need to be able to resist marketing of breast milk substitutes to mothers, because one of the pressures not to breastfeed is that it may be easier for some mothers to use breast milk substitutes, which frequently affect the baby's ability in the long term with respect to some diseases and their ability to fight certain infections. This is a typical requirement. Breastfeeding is in the mode of the public health nurse, and one of their required functions is to make sure that breastfeeding is well established in the postnatal period. But further to that, the Queen Elizabeth Hospital was a few years ago certified as a baby-friendly hospital, in which the mother, the baby was put on the mother's breast within, I think, half hour of birth. I think we might have lost that designation, and we need to work hard to recapture that designation again. But it starts with policies and programs within the Queen Elizabeth Hospital, and also the transitioning that the public health nurse ensures that particularly young mothers, high-risk mothers, etc., understand the concept of breastfeeding. I will stop there, and I will ask the Chief Nursing, the Director of Nursing Services at the QEH to speak on the recognition of QEH as a baby-friendly institution, and the Chief Nursing Officer with respect to their roles and obligations to the public.
Good afternoon again. Anastasia Jordan, Chief Nursing Officer. Breastfeeding is indeed an important aspect when it relates to monitoring and the whole ideology of how it impacts in terms of obesity. We've seen studies that have actually related and correlated that it does have an impact. You have to be cognizant of the fact, though, however, that we are dealing with a different generation that sees quickness and the whole notion of being preparing bottles rather than doing what we would like in terms of breastfeeding, but we are still pushing breastfeeding. Public health nurses usually have ongoing sessions, not only postnatally, but antenatally, encouraging mothers to use breastfeeding not only for the purpose of nutrition, but for bonding. So we have better establishment when it comes to the relationship between mother and child, and it is also pushed postnatally, looking at the economic costs that it also benefits in terms of reducing the amount of money spent on baby milk. I also say as a nurse, you do not see any other animal in the world buying formula. So it is something that we normally push, and it's something that is concentrated a lot on primary healthcare. And our public health nurses are well known for doing this, going out in the communities, helping young mothers who have challenges when it comes to breastfeeding, because there are many challenges you can have when it comes to breastfeeding. But as it relates to the baby-friendly status of the QEH hospital, this program was done a long time ago, and we are still maintaining it, but I'm going to ask the Director of Nursing Services at the QEH to elaborate a bit more on how we plan to sustain and reestablish the program.
Henderson Pinder, Director of Nursing Services, Queen Elizabeth Hospital. I want to just say to this August group that breastfeeding is one of the fundamental changes that we can make in Barbados' policies that will affect our future generations down the line. The benefits of breastfeeding have been well researched and published, and there are important indicators that help us to understand where we're going as a nation. The benefits have been already elucidated here, but what we can tell you for sure is that it is a process that begins way before, sometimes in the mind of the mother, way before the prenatal stage. And we want to get that kind of education out there where persons understand that it is from the time you decide that you are going to get pregnant that the decision should be made, or we should encourage our mothers to make that decision from that stage. So we are pressing on in this process. At present, we are still maintaining our baby-friendly accreditation, but however, we are scheduled to go back for recertification in the very near future. We have sought assistance from the Pan American Health Organization, and they are going to be working with us to help to establish some of the criteria that we need to see and meet for the accreditation to continue in the future. Additionally, we have brought on board one of our former nurses who was integral in the breastfeeding arena, and who has been a assessor and a facilitator in all the other hospitals throughout the Caribbean who have been accredited. Let me say that this accreditation, we take it for granted, but it's a very important accreditation, and many hospitals throughout the world are struggling to meet this accreditation, and we have been able to do it successfully for a number of times. And we are hoping in this present iteration that we will be given a certification, because we've put the processes in place. We are having meetings with our stakeholders. We have a meeting with the Ministry of Health. We have meetings with PAHO. We will then go into the community and spread it to all the stakeholders that when it comes to the time of implementation, every member of the community is aware of the benefits of breastfeeding and can help in this process. Additionally, we want to target our males. We are asking men, wherever you are, to support the women in their drive towards having the baby breastfed for 6 months on breast milk only. That's an important factor. And then the other thing would be to help in terms of our workplaces, to encourage workplace compliance with some of the criteria that are needed for this venture.
I see us working together in the very near future to see a full implementation and reaccreditation of the breastfeeding policy.
Thank you so much, Senior Minister. In my mind, these two questions are very related, and I think we have to get this right. I really do. I think the potential for Barbados to lose all of its progress could happen before our very eyes without us recognizing. I think this breastfeeding issue is tremendously important. I know we're about to do a parenting program. A part of it includes conversations on breastfeeding and working with the foundation that is the community-based foundation to do some of that work. Also now with the Ministry of Health, I would hope. But I think if we can get this right, we would have less persons depending on the social services sector. I think we're going to have less problems in the education sector. We have to see the dots and connect the dots, because we only see these things when they manifest themselves 20 years down the road. But the truth is we need to get this program right. The accreditation is extremely important. And I would just close by saying we're about to launch a PR program called Share the Care through the gender unit. And I think as I listen to you speak about the asking men to come forward and to help, part of sharing the care, and to do so reasonably, because sometimes men can have unreasonable responses to these things, to do so reasonably and to allow us to be able to build a better Barbados. But so I want to thank the ministry, I want to thank the staff for their responses, and I think they're doing a very good job. Thank you very much.
Thank you. Thank you, Honourable Member.
Honourable Leader of Government Business.
I promise to be short, Mr. Chair. I know, Minister, the team has been in the well for some time. But as I said on the outset yesterday, there are a number of pressing issues that I think members have brought out in the course of this debate, but that I wanted to put on the table as well. I know that the estimates speak to improvements to the Sir Winston Scott Polyclinic. We refer to it often as fast track. I recall a few months ago, I had the experience of having to go there with a young lady who had fallen ill, and had the opportunity to, walk around and notice certainly that the surroundings I found were not necessarily the best in terms of there's no pictures on the wall, the place wasn't well lit. I'm not sure what the cost that is in the estimates are specifically for in terms of the improvements, but really to say that, well, these are places where people go because they are sick. I think that we have to pay attention to the infrastructure and the aesthetics as well while people are also there. So my question relates, first of all, to what are the improvements being made? But secondly, I found on that occasion with the young lady that having left the fast track system, because there were only certain things that could be done there, the young lady had to go over to the accident and emergency. And having taken certain information at the polyclinic, the same information had to be taken all over again over at QEH. And I'm just wondering, where are we in the process of, for instance, the digitization of the records, and more specifically being able to, not have to go back through that process every single time that you go to one of the institutions?
Thank you, Honourable Member. It's two questions I see here in terms of the state of the walk-in clinic, the Winston Scott, and the work that was needed. I'm kind of sure that a lot of work has been done, because you also had industrial issues there. They had over Christmas time, I know they had shortage of staff. These matters being addressed as best we can. And certainly as it relates to staffing, I know that there's been, recently we got permission to hire, I think it's 10 clinical medical officers. So the staffing, the medical staffing should be adjusted now, can be adjusted. Mr. Haynes can speak to the work that has been done there and has to be done. And the matter of the digitization and all that, we covered yesterday, but I'm going to ask Minister Ishmael to give an overview of what we've done and what we're planning as it relates to medical records, digitization, and health information systems. Thank you.
Chairman, Greg Sahin, Senior Technical Officer, Ministry of Health and Wellness. With respect to the honorable member, with the work going on at Vincent Scott Polyclinic, currently we are doing some major upgrades with respect to painting. We are about 3/4 complete with respect to that. We have some challenges in that we are trying to manage doing the works without hindering the services at the clinic. However, we will continue to work at its best to get these tasks completed. With respect to upgrading many of the spaces as well, we would have introduced some upgrades to the wound care room, the cubicle spaces the nurses occupy by cooling the spaces with ACs, upgrading the electricals. We would have dealt with some poor drainage issues on the roof that would create some leaks as well. So we realize Vincent Scott is most unique because we categorize it as a mini hospital. And the objective of the ministry is to put a specific focus at that institution while executing work not to halt the services, but to improve overall service at that facility.
Thank you, Honourable Member, for the question. And we would have referenced previously in this discussion the procurement of the health information system. And the health information system will do exactly what you would have alluded to in terms of being able to follow and track a patient from one part of the health network through to the other. The ministry has a vision that through the procurement and the implementation and rollout of that health information system, that wherever a citizen of Barbados interacts with the polyclinics or which is primary care all the way through to the hospital, from accident emergency all the way through to the wards, that electronic record of them would be able to follow them wherever they go. Now, there are reasons why, clinical reasons, and I'm not a doctor, but there are clinical reasons why a person may be asked the same question multiple times across the various stages of their journey throughout the hospital. I believe it helps with ensuring that you have the right person that you're dealing with. That is a very important part of the process. But we do understand that sometimes there can be repetition because there is really no digital record that would allow the clinician, the doctor or the nurse to be able to get the information at their fingertips. So the health information system and the digitization and digitalization process that we're undertaking right now of the QH IT project, which, as I said before, is a 30-month project, is really designed to get us to the stage where the QEH and the rest of the health network is performing at a far more advanced, technologically proficient level. So I believe that as we go through this process, we're right now, and just to give a further update on where we are, we have already started a robust and comprehensive needs assessment. The needs assessment is very technical. It allows for the team, the project team that's leading this process, it allows them to go into every specific department at the QEH in particular, that's where we're starting, and to see exactly what technologies are currently being used, what services are currently being rendered, what are their current processes, and how do we then re-engineer those processes, and what solution that we're going to go there to procure, how are we going to match those needs to the solution that we're going to bring and implement. So that needs assessment is comprehensive, is already underway, and I believe within the course of this month of March, that is going to be completed, and then during the course of April, we're going to continue with the development of an RFP and go through the process towards procuring that software platform. Once the health information system is procured, that will then help us to be able to start to connect all of the dots throughout the system, and there's a technical word, interoperability, that allows all of those various parts of the QEH and the health network by extension to be able to speak to each other, and therefore affording every single citizen the opportunity to have their records going wherever they go. I envision, and also, yes, and by extension, the private sector as well. So in other words, we envision a Barbados where citizen Joe can walk into his polyclinic, his or her polyclinic, well, Joe, walk into his polyclinic, or go to his private GP and be able to have his health record pulled up there. He could have prescriptions administered, and he can then, if he has to, interact with the accident and emergency or to the QEH on a ward. That same information can be pulled up on the same health information system. All of it speaking together, all of it being updated in real time, all of it being very secure, robustly secured, so that we don't have data breaches and different things like that. But of course, we make sure that any health information system has robust cybersecurity attached to it, so that that data and that information can only be accessed by who is supposed to access it, with the relevant permissions being given by the citizen. So in a nutshell, that project is well underway, and we believe that within the next 30 months or so, even less than, we should see the health information infrastructure of the QEH enhanced significantly and beyond QEH towards the rest of the healthcare system. Thank you.
Good afternoon. I want to address the issue relating to the infrastructure that the Honourable spoke to in relating to the Winston Scott Polyclinic. Very soon, there will be more or less a facelift of the exterior walls of the polyclinic, where there will be a mural that will be placed on the walls. Now recently, a mural to be placed on the exterior walls. Most recently, I had the opportunity to review the pictures for the mural, and we're currently in the advanced stages of preparing to have that placed on the exterior walls. Also, within the next couple of days, there'll be work done in the polyclinic of itself, where the floor will be resurfaced and replaced, and some additional work to its interior. So we are cognizant of the need to upgrade the polyclinic, and that is being done as well. I also would like to mention that there's going to be, under the Saudi Development Plan Fund, there's going to be relocation of 2 polyclinics. Those are the Newlis Gibson and Randall Phillips, and then the other 7 polyclinics are going to be refurbished. So we are quite aware of the need to refurbish and relocate the polyclinics. So in addition to Sir Winston Scott Polyclinic, the others will also be addressed.
I want to thank you for that, Minister, and those who spoke. It means that you are listening, both in relation to linear accelerators and also in relation to the improvements at Sir Winston Scott. So I would take it that my comments to you have not been in vain, and I appreciate the fact that it has been included in this year's estimates. The other question, though, that I have relates, I know we've said a lot in relation to human resources at the Queen Elizabeth Hospital and throughout the system, and provision has obviously been made in this year's estimate specifically to deal with it. But one of the things that I would like us to just zoom in on specifically is as it relates to, first of all, the accident and emergency department. My understanding is obviously that there had been some challenges in relation to doctors, particularly being able to do the assessments after the nurses have done performed their role, and to be able to have the specific doctors there to be able to evaluate and then to assess those persons to send them on to their other cares. But one of the things that I'm not sure about is whether we have already addressed it or whether these estimates are taking that into account. And then secondly, as it relates to A&E, because that is the place where most people go for the initial intervention, is whether we have addressed the issue of the on-call doctors. Because I have recognized that from personal experience that if you get sick in the middle of the night, oftentimes, despite speeding up now of being able to have certain tests done, radiological examinations done, what often happens is that sometimes the results are not read until perhaps the next morning. Meanwhile, patients are obviously waiting for those results to be read. So have we actually addressed the issue in these estimates as well in terms of improvements to on-call doctors and having those persons really be on call? I know that other colleagues would have raised the issue of a 24-hour hospital. And obviously, if we move in that direction, a lot of these issues will be put behind us. But what are the steps being taken for this year to be able to ensure that on-call really means that the person is sitting, waiting, whether in Barbados or some other part of the world, to be able to respond and to give doctors here in Barbados who are dealing and interfacing with the patients real-time information so that action can be taken almost immediately in relation to patient care?
Thank you, Honourable Member. I'm going to going to speak to some of these, and then I'm going to ask Dr. Anne-Marie Cruikshank, who is in charge of A&E, to probably speak to it too. Obviously, I said yesterday that there's going to be an expansion, plans for equipment, all of this we have taken consideration of. Specifically, the matter of on-call. As I recall, doctors working in accident and emergency work overtime. I don't think it has changed. I am not certain when you speak of on-call, we speak of the doctors who work in the wards, who oftentimes are required, patients are waiting there to be reviewed by these on-call doctors.
I'm speaking about the persons who read the results, so like
you're talking about,
radiologists
okay.
specifically.
Radiologists and the lab
but to
techs.
your point, I think there's also the part that most people don't see, which is the other floors where patients are waiting to be seen by consultants, for instance.
Right, that's what I'm speaking
and
to.
whether that has also really been addressed.
Because we, as part of the HR agreement, we're supposed to get additional registrars for the medical floors, because that is usually the major problem. The staff in internal medicine, we are supposed to get the additional registrars that have been asked for to try to alleviate that. The matter about the space will be doubled. The recurrent factor will often be, however, the elderly for care, who are going to be there, you get rid of them and they come again. The matter of lab, and there's been discussion about getting point of care machines to do some tests there at the bedside while we continue to work, but the lab techs are paid, some are on call and some get overtime. That has to be sorted out, the logistics of that. As it relates to the X-ray, we are looking to put a CT scan there. Oftentimes that is a tremendous delay. I think you know that, especially with people with strokes. So having an X-ray, a CT scan there, that is expected to cut out that with you. You'll get the staff that you need to run it 24 hours there. So that should be somewhat eradicated. They're proposing to get additional staff in all categories. Doctors, specified doctors that are specialized in accident and emergency, who have finished their training. Nurses, they've got requests for orderlies, additional orderlies. So all categories of staff in the A&E are supposed to be addressed. I don't know if Dr. Cruikshank wants to speak a bit more.
Good afternoon to the Chairman. Good afternoon, Minister. As respect to what the Honourable Minister said, with respect to the on-call, we've had some challenges with that, as you would have known when you've passed through the accident and emergency. And we've put in some proposals.
Officer, we didn't hear your introduction too clearly.
Sorry.
Your name and your
Please excuse
position.
me. Dr. Anne-Marie Cruikshank. I'm the head of accident and emergency. As the Honourable Minister would have mentioned, we are looking at on-call. On-call is with respect to the doctors that work on the ward. So it's not really part of accident emergency. But if we're moving to a 24-hour hospital, we are now looking to see that hiring more consultants, which may be present in the accident and emergency on a 24-hour basis. So we've requested 2 additional consultants to be part of our team. Also senior registrars, which will give us more coverage with respect to senior cover in the accident and emergency department. Also other categories of staff in terms of departmental aides, orderlies, more nurses, more nursing assistants, where we can get a greater coverage for the patients. As you know, we are currently short-staffed, and a lot of nurses and doctors, sessional doctors and flexi nurses have to come to assist. So I think staffing is something we're focusing on, extremely important in the accident and emergency, to move towards this 24-hour hospital that we're hoping for.
Thank you, Minister. Thank you, Dr. Cruikshank. And I just want to say that for the record that I have seen the improvements at QEH in terms of especially A&E in relation to the infrastructure. I know during COVID we would have spent a lot of funds to be able to improve the spaces there. I know there's still a lot more works that are ongoing. There are still improvements to be made, obviously, in terms of the delivery of service. But I think as somebody who has been through the system there on many occasions, I personally can say that I can see money well spent in terms of the improvements. And I would just want to encourage the staff at the hospital, and certainly you in particular, Minister, while the criticisms may come, I think we have to keep focused in terms of the transformation that is necessary, providing the relevant staffing in particular to the departments, and of course the equipment. And so my last and final question relates to two things, the PET scan machine, and also relates to genetic testing. I could not leave this debate without asking for an update on either of these two things. PET scan machines as it relates to the ability to be able to help persons to know whether cancer has spread, because that helps people to make decisions in terms of their future. And I'm finding that a lot of persons they know that they have traces of cancer in their family. But in many instances, they're scared to come forward, yes, but also that the cost sometimes of getting the genetic testing can sometimes be a bit prohibitive. So I just want to, that's the concerns I'm hearing raised. I don't know if we've addressed it fully in terms of access to genetic testing and the speed at which it can turn around, but I hope that that is certainly on the cards if it hasn't already been considered. And then as it relates to the PET scan machine, obviously, we've been talking about this for quite some time. It's almost like talking about the incinerator or the linear accelerator. We know that these are pieces of equipment that can help save lives, that can do the necessary interventions. Many people who are able to have the PET scan machines oftentimes have to go overseas, which again is a cost to government, is a cost to individuals, and sometimes it is out of reach for the most vulnerable in our society. So whether it is that if we are looking in that direction, I would like to know whether private or joint partnership, or whether we're able to leverage on the relationships with other territories that have these machines to be able to ensure that people have a chance of being able to survive.
Thank you. We are looking at PET scans, but not right now, not at the immediate. I think that is the one that they're more likely to get a joint venture, because certain entities, a lot of insurance companies have to pay for people to go overseas, Miami or Puerto Rico, for PET scanners. So it is certainly something in the QEH expansion that I spoke about, where I spoke about an ontological center. There is provision in there for PET scan. In terms of immediately, right now, we have not focused on that at this point. Oh, sorry. The other question is about DNA typing. We are now, I guess, in the embryonic stage. You would have heard Dr. Becker speak about doing genotyping, as that relates primarily now to transplant surgery. But you've heard me speaking also about the living lab, which is expecting now to go into that aspect of DNA typing and stuff like that, and then going to recognize that a number of these cancers have their origin in genetics. But that is looking at the Barbados Living Lab in conjunction with the Bester Santos Lab. But we're also preparing for that. Again, we will need a number of young scientists, and we're looking at this. And I'm hoping to have the structure finished and outfitted, and then we have to get additional posts for the Living Lab. We'll be looking at young people, interested in research. Thank you.
Without prolonging much, Kenneth George, PAHO is assisting us with the genetic piece. Actually, Sanji may be able to give a quick update. She has been invited to a workshop where we're trying to build out the capacity with respect to the Bester Santos Public Health Laboratory. And why this is important also is that as we move towards the living lab, these areas will need to be discussed much more in much more detail, and the investment given.
Good afternoon, Dr. Sanji Beckles, Director of the Bester Santos Public Health Laboratory. With respect to genetic testing, Minister, we do see that as a very important part of the testing in terms of follow-up and monitoring, not only of persons to identify if they're at risk, but even to determine if they're progressing and if they're responding well to treatment or when cancers are actually reoccurring. And as a part of the Living Lab, the whole purpose of the Living Lab is for research, and it's, in my mind, it's living, and we are supposed to be dealing with things that are current and respond to the things that are important to persons in Barbados and outside of the region as well. And cancer diagnostics is one of the very important areas that we want to get into. As the minister did rightly say, we are in embryonic stages. The building is under renovation right now and should be completed, hopefully, within the next few weeks. We have procured some equipment already and do have some in this year's estimates to procure some equipment for that testing, including the genetic testing. To be quite honest, one of the first markers based on our expansion of colorectal cancer, one of the pieces of equipment I had identified can help look at some of the genetic markers to respond to that. But of course, that is only one of the many cancers in Barbados that are of concern, and we would endeavor to also break out into other areas and other tests to be able to capture genetic testing for all the cancers of importance in Barbados.
Thank you.
Thank you. Honorable Minister, you can wind up and then move to the head stand part.
Thank you, Mr. Chairman. I want to thank you and the honorable members of Parliament for accommodating the staff of the Ministry of Health and Wellness, Minister S. Marshall and myself. Over the last almost 2 days, as we responded to your questions, we were pleased to be able to respond to your questions, which were many and varied, and we were delighted to inform you and explain to you what was happening with the plans for the Ministry of Health and Wellness going forward. We recognize that there are several deficiencies within the Ministry of Health and Wellness, but we are working assiduously to rectify a number of these. Oh, sorry. I thought I had said the Ministry of Health and Wellness. I thought I had mentioned it, but I'm told the entire team of the Ministry of Health and Wellness. Well, absolutely, I thought that was... Okay. Now I've lost my train. Anyhow, I want to thank you. I recognize that we have some deficiencies, and we will be working assiduously, me and the entire team of the Ministry of Health and Wellness, to deal with those matters. But also we need the support of my colleagues, my ministerial colleagues in the various ministries, and certainly the support of all the members of Parliament in achieving some of our goals and our aims. And I certainly said, I can't say it was a very interesting period. I missed some of the members, in particular, one member today, and I was looking forward to further briefing him and perhaps elucidating matters for him, but unfortunately, he wasn't here for the entire day. That's it. I just want to, again, express my appreciation for being able to be here with my team to speak to you and to respond to your queries and your questions. Thank you, sir.
Mr. Chairman, I beg to move that Head 86 stand part.
The question is that Head 86 stand part. All honorable members in favor, say aye. Honorable members against, say no. Methinks the ayes have it. Honorable Leader of Government Business.
Mr. Chairman, I beg to move that you do not report progress to His Honor the Speaker and beg leave to sit again.
The question is that I do not report progress to Her Honor the Deputy Speaker and beg for leave to sit again. All honorable members in favor, say aye. Honorable members against, say no. Methinks the ayes have it.
Honourable members, your chairman has reported progress and has asked to leave again.
Madam Deputy Speaker, I beg to move the House be suspended until 3:15 p.m.
3:15? The question is that this House be suspended until 3:15 p.m. All honourable members in favour, please say aye. Those against, please say no. We think the ayes have it. This House is now suspended until 3:15 p.m.